1. Introduction to cold exposure therapy. 1.1 What is cold exposure therapy? Cold exposure therapy, also known as cryotherapy or cold thermogenesis, is a therapeutic practice that involves exposing the body to cold temperatures for various health benefits. This therapy has been used for centuries in different cultures around the world, and it has gained significant attention in recent years due to its potential positive effects on physical and mental well-being. Cold exposure therapy can be implemented in several ways, including cold showers, ice baths, cryotherapy chambers, and outdoor cold exposure. The duration and intensity of the exposure can vary depending on individual preferences and goals. While the idea of subjecting oneself to cold temperatures may seem uncomfortable or even daunting, the practice has been shown to have numerous benefits for overall health and wellness. The principle behind cold exposure therapy lies in the body's natural response to cold temperatures. When exposed to cold, the body activates a series of physiological mechanisms to maintain its core temperature. This process, known as thermoregulation, involves vasoconstriction, narrowing of blood vessels, to conserve heat and shivering to generate heat. These responses not only help the body stay warm but also trigger a cascade of beneficial effects. One of the primary benefits of cold exposure therapy is its ability to stimulate the immune system. Cold temperatures can enhance the production of white blood cells, which play a crucial role in fighting off infections and diseases. Additionally, cold exposure has been shown to increase the activity of natural killer cells, which are responsible for identifying and destroying cancer cells and infected cells. By boosting the immune system, cold exposure therapy may help reduce the risk of illness and improve overall health. Cold exposure therapy also has a positive impact on the cardiovascular system. When exposed to cold, the body's blood vessels constrict, which can improve circulation and blood flow. This increased circulation can enhance the delivery of oxygen and nutrients to the muscles and organs, promoting their optimal function. Cold exposure has also been shown to lower blood pressure and improve heart rate variability, which is an indicator of cardiovascular health. In addition to its effects on the immune and cardiovascular systems, cold exposure therapy can also have a profound impact on mental well-being. Cold showers or baths have been found to increase alertness and improve mood by triggering the release of endorphins, the body's natural feel-good hormones. Cold exposure has also been associated with reduced symptoms of depression and anxiety, as well as improved cognitive function and mental resilience. Furthermore, cold exposure therapy has been shown to have benefits for physical performance and recovery. Cold temperatures can help reduce inflammation and muscle soreness, making it an effective tool for athletes and individuals engaged in intense physical activity. Cold exposure has also been found to enhance muscle recovery and improve endurance, allowing individuals to push their limits and achieve better results in their fitness pursuits. Another intriguing aspect of cold exposure therapy is its potential for weight loss and metabolism regulation. Cold temperatures can activate brown adipose tissue, BAT, a type of fat that generates heat by burning calories. By increasing BAT activity, cold exposure can boost metabolism and increase calorie expenditure, potentially aiding in weight loss efforts. Additionally, cold exposure has been shown to improve insulin sensitivity, which can help regulate blood sugar levels and prevent the development of metabolic disorders such as diabetes. While cold exposure therapy offers numerous benefits, it is essential to approach it with caution and follow safety guidelines. Individuals with certain health conditions, such as Raynaud's disease or cardiovascular problems, should consult with a healthcare professional before engaging in cold exposure therapy. It is also crucial to start gradually and allow the body to adapt to the cold over time to avoid potential adverse effects. In conclusion, cold exposure therapy is a therapeutic practice that involves exposing the body to cold temperatures for various health benefits. From immune system stimulation to cardiovascular health improvement, mental well-being enhancement, and physical performance optimization, cold exposure therapy offers a wide range of advantages. By understanding the principles and safety precautions associated with this therapy, individuals can incorporate cold exposure into their daily routines and harness its potential for improved health and wellness. 1.2 History of cold exposure therapy. Cold exposure therapy, also known as cryotherapy, has a long and fascinating history that dates back thousands of years. The practice of using cold temperatures for therapeutic purposes can be traced back to ancient civilizations, where people recognized the healing properties of cold water and ice. One of the earliest recorded instances of cold exposure therapy can be found in ancient Egypt. The Egyptians used cold water and ice to treat various ailments and injuries. They believed that the cold temperatures could reduce inflammation, numb pain, and promote healing. The famous Egyptian physician Imhotep even wrote about the benefits of cold therapy in his medical texts. In ancient Greece, the renowned physician Hippocrates also recognized the therapeutic effects of cold exposure. He used cold water and ice to treat injuries, reduce swelling, and relieve pain. Hippocrates believed that cold temperatures could constrict blood vessels and decrease blood flow, which could help in the healing process. During the Middle Ages, cold exposure therapy continued to be used as a form of treatment. Physicians and healers would apply cold compresses to wounds and injuries to reduce pain and inflammation. Ice baths were also used to treat various conditions, including fever and mental illnesses. In the 19th century, the concept of cryotherapy began to gain more attention. Dr. James Arnott, a British physician, developed a method of using cold temperatures to treat various medical conditions. He used a device called the Arnott's freezing apparatus, to apply cold to specific areas of the body. This method was particularly effective in treating skin conditions, such as warts and tumors. In the early 20th century, the use of cold exposure therapy expanded further. Dr. John Harvey Kellogg, a prominent physician and health advocate, popularized the use of cold water treatments in his wellness programs. He believed that cold water could stimulate the body's natural healing mechanisms and improve overall health. During World War I, cold exposure therapy gained recognition for its ability to treat frostbite and other cold-related injuries. Military doctors used cold water immersion and ice packs to prevent tissue damage and promote healing. This led to further research and advancements in the field of cryotherapy. In the 1970s, a Japanese doctor named Dr. Toshima Yamauchi developed a method of whole-body cryotherapy. He used liquid nitrogen to create extremely cold temperatures, which patients would be exposed to for a short period of time. This method gained popularity in Europe and later spread to other parts of the world. In recent years, cold exposure therapy has gained significant attention in the health and wellness community. Athletes, celebrities, and health enthusiasts have embraced cryotherapy as a way to improve physical performance, enhance recovery, and promote overall well-being. Cryotherapy chambers and cryosaunas have become increasingly popular, offering a more accessible and controlled environment for cold exposure therapy. Research into the physiological and psychological effects of cold exposure therapy has also expanded. Studies have shown that cold temperatures can stimulate the release of endorphins, improve circulation, boost the immune system, and increase metabolic rate. These findings have further contributed to the growing interest in cold exposure therapy as a natural and holistic approach to health and wellness. In conclusion, cold exposure therapy has a rich history that spans across ancient civilizations to modern times. From the Egyptians and Greeks to the advancements in cryotherapy technology, the therapeutic benefits of cold temperatures have been recognized and utilized for centuries. As our understanding of the human body and the effects of cold exposure continues to evolve, cold exposure therapy is likely to remain a valuable tool in promoting health, well-being, and longevity. 1.3 Benefits of cold exposure therapy. Cold exposure therapy, also known as cryotherapy, has gained significant attention in recent years due to its potential health benefits. While the idea of subjecting oneself to extreme cold may seem daunting, research suggests that cold exposure therapy can have numerous positive effects on both the body and mind. In this section, we will explore some of the key benefits of cold exposure therapy. 1. Boosts the immune system. One of the most notable benefits of cold exposure therapy is its ability to enhance the immune system. Cold exposure stimulates the production of white blood cells, which are responsible for fighting off infections and diseases. Studies have shown that regular cold exposure can increase the levels of natural killer cells, which play a crucial role in the body's defense against viruses and cancer cells. By strengthening the immune system, cold exposure therapy may help reduce the risk of illness and improve overall health. 2. Improves circulation. Cold exposure therapy has been found to improve blood circulation throughout the body. When exposed to cold temperatures, blood vessels constrict, which helps to push blood towards vital organs and tissues. This constriction is followed by vasodilation, where the blood vessels expand, allowing for increased blood flow. This process not only improves circulation but also helps deliver oxygen and nutrients to the muscles and organs, promoting their optimal function. 3. Enhances mental resilience. Cold exposure therapy has been shown to have a positive impact on mental resilience. By subjecting oneself to uncomfortable and challenging conditions, individuals can develop a greater tolerance for discomfort and stress. This increased resilience can translate into various aspects of life, helping individuals cope with difficult situations, manage stress, and maintain a positive mindset. Cold exposure therapy can be seen as a form of mental training, allowing individuals to build mental toughness and adaptability. 4. Increases energy and alertness. Cold exposure therapy has the potential to increase energy levels and promote alertness. When exposed to cold temperatures, the body releases adrenaline and noradrenaline, which are hormones that can boost energy and focus. This surge of hormones can provide a natural pick-me-up, making individuals feel more awake and alert. Cold exposure therapy can be particularly beneficial for those who struggle with fatigue or need an extra energy boost to start their day. 5. Supports weight loss. Cold exposure therapy has been linked to weight loss and improved metabolism. When exposed to cold temperatures, the body activates brown fat, a type of fat that burns calories to generate heat. This activation of brown fat can increase calorie expenditure and potentially aid in weight loss efforts. Additionally, cold exposure therapy has been shown to improve insulin sensitivity, which can help regulate blood sugar levels and prevent weight gain. 6. Reduces inflammation. Inflammation is a natural response of the body to injury or infection. However, chronic inflammation can contribute to various health issues, including cardiovascular disease, arthritis, and autoimmune disorders. Cold exposure therapy has been found to reduce inflammation by suppressing the production of pro-inflammatory cytokines. By reducing inflammation, cold exposure therapy may help alleviate symptoms associated with inflammatory conditions and promote overall well-being. 7. Enhances recovery and muscle performance. Cold exposure therapy has been widely used in sports medicine to enhance recovery and improve muscle performance. Cold temperatures help reduce muscle inflammation and soreness, allowing athletes to recover faster between training sessions. Additionally, cold exposure therapy can improve muscle strength and endurance by increasing blood flow and oxygen delivery to the muscles. This can lead to improved athletic performance and reduced risk of injuries. 8. Promotes mental health and well-being. Cold exposure therapy has shown promise in promoting mental health and well-being. Cold exposure stimulates the release of endorphins, which are natural mood-boosting chemicals in the brain. This can help alleviate symptoms of depression and anxiety, improve mood, and promote a sense of well-being. Cold exposure therapy has also been found to improve sleep quality, which is essential for maintaining mental health. 9. Anti-aging effects. Cold exposure therapy may have anti-aging effects on the body. Cold temperatures can stimulate the production of collagen, a protein that helps maintain the elasticity and firmness of the skin. This can help reduce the appearance of wrinkles and fine lines, giving the skin a more youthful appearance. Additionally, cold exposure therapy has been shown to improve cognitive function, which can help combat age-related cognitive decline. 10. Promotes overall wellness. Overall, cold exposure therapy offers a range of benefits that contribute to improved overall wellness. From boosting the immune system and enhancing mental resilience to supporting weight loss and promoting mental health, cold exposure therapy has the potential to positively impact various aspects of life. Incorporating cold exposure therapy into a well-rounded wellness routine can help individuals achieve optimal health and well-being. In the next section, we will discuss important safety precautions to consider when engaging in cold exposure therapy. 1.4 Safety precautions for cold exposure therapy. Cold exposure therapy can provide numerous benefits for both physical and mental health. However, it is important to approach this therapy with caution and take necessary safety precautions to ensure a safe and effective experience. While cold exposure therapy is generally safe for most individuals, there are certain guidelines and safety measures that should be followed to minimize the risk of adverse effects. In this section, we will discuss some important safety precautions to consider when engaging in cold exposure therapy. 1. Consult with a healthcare professional. Before starting any new therapy or wellness practice, it is always advisable to consult with a healthcare professional, especially if you have any pre-existing medical conditions or concerns. They can provide personalized guidance and ensure that cold exposure therapy is suitable for your specific health needs. Additionally, they can help you determine the appropriate duration and intensity of cold exposure sessions based on your individual circumstances. 2. Start slow and gradually increase exposure. When beginning cold exposure therapy, it is crucial to start slow and gradually increase your exposure to cold temperatures. Sudden and extreme exposure to cold can be dangerous and may lead to hypothermia or other adverse effects. Begin with shorter durations of exposure, such as a few seconds, and gradually increase the time as your body adapts to the cold. This gradual progression allows your body to acclimate and reduces the risk of shock to your system. 3. Avoid cold exposure if you have certain medical conditions. While cold exposure therapy can be beneficial for many individuals, there are certain medical conditions that may make it unsafe or unsuitable. If you have any of the following conditions, it is important to avoid cold exposure therapy or seek guidance from a healthcare professional. Raynaud's disease. This condition causes blood vessels in the extremities to constrict excessively in response to cold temperatures, leading to pain and numbness. Cold-induced urticaria. This is a condition characterized by hives or skin rashes that occur in response to cold exposure. Frostbite or cold injuries. If you have a history of frostbite or cold-related injuries, it is important to exercise caution and consult with a healthcare professional before engaging in cold exposure therapy. Respiratory conditions. Individuals with respiratory conditions such as asthma or chronic obstructive pulmonary disease, COPD, should be cautious with cold exposure therapy, as it may trigger symptoms or exacerbate their condition. 4. Dress appropriately for cold exposure. When engaging in cold exposure therapy, it is essential to dress appropriately to protect your body from extreme cold temperatures. Wear warm clothing that covers your extremities, such as gloves, socks, and a hat, to prevent heat loss from these areas. Layer your clothing to provide insulation and trap body heat. Additionally, consider using thermal blankets or insulated mats to sit or lie on during cold exposure sessions to minimize heat loss from contact with cold surfaces. 5. Avoid cold exposure if you are pregnant. Pregnant women should avoid cold exposure therapy, especially in extreme cold temperatures. Exposure to cold temperatures can cause vasoconstriction, which may reduce blood flow to the uterus and potentially harm the developing fetus. It is important to prioritize the safety and well-being of both the mother and the baby during pregnancy. 6. Stay hydrated and nourished. Cold exposure therapy can increase the body's energy expenditure and may lead to dehydration if adequate fluid intake is not maintained. It is important to stay hydrated before, during, and after cold exposure sessions. Drink water or warm fluids to replenish lost fluids and maintain proper hydration levels. Additionally, ensure that you are adequately nourished by consuming a balanced diet that provides sufficient calories and nutrients to support your body's energy needs. 7. Listen to your body. Pay close attention to your body's signals and listen to any discomfort or warning signs during cold exposure therapy. If you experience severe shivering, dizziness, numbness, or any other concerning symptoms, it is important to stop the session immediately and seek warmth. Pushing through extreme discomfort or ignoring warning signs can increase the risk of hypothermia or other cold-related injuries. Always prioritize your safety and well-being. 8. Avoid cold exposure if you are ill or fatigued. If you are feeling unwell or fatigued, it is advisable to avoid cold exposure therapy until you have fully recovered. Cold exposure can put additional stress on your body, and engaging in it while already weakened may increase the risk of illness or injury. Allow your body to rest and recover before resuming cold exposure sessions. 9. Be mindful of cold water immersion. If you are engaging in cold exposure therapy that involves cold water immersion, such as ice baths or cold showers, take extra precautions to ensure your safety. Never immerse your head underwater, as this can increase the risk of cold shock and potentially lead to drowning. Additionally, avoid prolonged exposure to extremely cold water, as it can cause hypothermia. Always have a timer or someone nearby to monitor your session and be prepared to exit the water if necessary. By following these safety precautions, you can minimize the risks associated with cold exposure therapy and enjoy its numerous benefits. Remember to prioritize your safety, listen to your body, and seek guidance from a healthcare professional if you have any concerns or medical conditions. With proper precautions, cold exposure therapy can be a safe and effective practice for improving your overall well-being. 2. Physiological effects of cold exposure. 2.1 How cold exposure affects the body. Cold exposure therapy, also known as cryotherapy, involves subjecting the body to cold temperatures for therapeutic purposes. This practice has been used for centuries and has gained popularity in recent years due to its numerous health benefits. When the body is exposed to cold temperatures, it undergoes several physiological changes that can have a profound impact on overall well-being. One of the primary ways that cold exposure affects the body is through the activation of the sympathetic nervous system. When exposed to cold, the body's fight or flight response is triggered, leading to the release of stress hormones such as adrenaline and noradrenaline. This response increases heart rate, blood pressure, and metabolic rate, preparing the body for action. As a result, cold exposure can provide a natural energy boost and improve alertness and focus. Cold exposure also stimulates the production of brown adipose tissue, fat, also known as brown fat. Unlike white fat, which stores energy, brown fat generates heat by burning calories. When exposed to cold temperatures, brown fat is activated, leading to an increase in energy expenditure and potentially aiding in weight loss. Additionally, the activation of brown fat has been shown to improve insulin sensitivity, which can help regulate blood sugar levels and reduce the risk of developing type 2 diabetes. Furthermore, cold exposure has a profound effect on the cardiovascular system. When exposed to cold, blood vessels constrict in a process known as vasoconstriction. This narrowing of blood vessels helps to conserve heat and maintain core body temperature. However, vasoconstriction also increases blood pressure, which can be beneficial for individuals with low blood pressure or poor circulation. Cold exposure has been shown to improve blood flow and enhance cardiovascular function, leading to improved heart health and reduced risk of cardiovascular diseases. In addition to its effects on the cardiovascular system, cold exposure also has a significant impact on the immune system. Cold temperatures stimulate the production of white blood cells, which are essential for fighting off infections and diseases. Cold exposure has been shown to increase the activity of natural killer cells, which play a crucial role in the body's defense against viruses and cancer cells. By boosting the immune system, cold exposure can help prevent illness and promote overall health. Another way that cold exposure affects the body is through its anti-inflammatory properties. Cold temperatures have been shown to reduce inflammation by decreasing the production of pro-inflammatory cytokines. This can be particularly beneficial for individuals with chronic inflammatory conditions such as arthritis or autoimmune diseases. Cold exposure has been found to alleviate pain and swelling associated with inflammation, providing relief and improving quality of life. Furthermore, cold exposure has been shown to have a positive impact on mental health. Cold temperatures stimulate the release of endorphins, which are natural mood-boosting chemicals in the brain. This can lead to an improvement in mood, reduced symptoms of depression, and increased feelings of well-being. Cold exposure has also been found to reduce stress levels by lowering cortisol, the stress hormone. By promoting relaxation and reducing anxiety, cold exposure can contribute to better mental health and overall emotional well-being. It is important to note that while cold exposure therapy can provide numerous benefits, it should be approached with caution and under the guidance of a healthcare professional. Individuals with certain medical conditions, such as Raynaud's disease or cardiovascular disorders, may need to avoid or modify cold exposure practices. Additionally, it is essential to start with gradual exposure and increase intensity over time to allow the body to adapt to the cold temperatures. In conclusion, cold exposure therapy has a profound impact on the body's physiology. From activating the sympathetic nervous system and brown fat to improving cardiovascular function and boosting the immune system, cold exposure offers a wide range of health benefits. Additionally, it can positively influence mental health by promoting relaxation and reducing stress. However, it is crucial to approach cold exposure therapy safely and consult with a healthcare professional to ensure its suitability for individual circumstances. 2.2 Cold-induced thermogenesis. Cold-induced thermogenesis is a fascinating physiological response that occurs when the body is exposed to cold temperatures. It is a natural mechanism that helps regulate body temperature and maintain homeostasis. This process involves the activation of brown adipose tissue (fat) and the release of heat to generate warmth. When exposed to cold, the body initiates a series of complex reactions to generate heat and maintain its core temperature. One of the key players in this process is brown adipose tissue, also known as brown fat. Unlike white fat, which stores energy, brown fat is specialized in generating heat through a process called thermogenesis. Brown fat is primarily found in newborns and hibernating animals, but recent research has shown that adults also possess small amounts of active brown fat. When exposed to cold temperatures, brown fat is activated, and its cells start to burn stored fat and glucose to produce heat. This heat is then released into the body, helping to raise the overall body temperature. The activation of brown fat and the subsequent heat production is known as cold-induced thermogenesis. This process not only helps to maintain body temperature but also has several other beneficial effects on the body. One of the significant benefits of cold-induced thermogenesis is its potential for weight management. When brown fat is activated, it increases the body's energy expenditure, leading to the burning of calories. This increased calorie burn can contribute to weight loss or weight maintenance, making cold exposure therapy a potential tool for those looking to manage their weight. Furthermore, cold-induced thermogenesis has been shown to improve insulin sensitivity. Insulin is a hormone that regulates blood sugar levels, and when the body becomes resistant to insulin, it can lead to the development of type 2 diabetes. Studies have found that cold exposure can enhance insulin sensitivity, potentially reducing the risk of developing diabetes and improving overall metabolic health. Cold-induced thermogenesis also has a positive impact on cardiovascular health. When brown fat is activated, it not only burns calories but also helps to regulate lipid levels in the blood. This can lead to a decrease in harmful cholesterol levels, reducing the risk of cardiovascular diseases such as heart attacks and strokes. In addition to its metabolic benefits, cold-induced thermogenesis has been found to have anti-inflammatory effects. Chronic inflammation is associated with various health conditions, including autoimmune diseases, obesity, and even cancer. Cold exposure therapy has been shown to reduce inflammation markers in the body, potentially providing relief for individuals suffering from inflammatory conditions. Moreover, cold-induced thermogenesis can enhance the immune system. Cold exposure stimulates the production of immune cells, such as natural killer cells and T cells, which play a crucial role in fighting off infections and diseases. By boosting the immune system, cold exposure therapy may help individuals become more resilient to common illnesses and infections. Cold-induced thermogenesis also has implications for athletic performance and recovery. Cold exposure has been shown to improve muscle recovery by reducing inflammation and promoting blood flow to the muscles. Additionally, it can enhance endurance and performance by increasing oxygen uptake and improving cardiovascular function. It is important to note that cold exposure therapy should be approached with caution, especially for individuals with certain health conditions or those who are pregnant. It is always recommended to consult with a healthcare professional before starting any new therapy or treatment. In conclusion, cold-induced thermogenesis is a fascinating physiological response that occurs when the body is exposed to cold temperatures. It involves the activation of brown adipose tissue and the release of heat to generate warmth. This process has numerous benefits, including weight management, improved insulin sensitivity, cardiovascular health, anti-inflammatory effects, enhanced immune function, and potential benefits for athletic performance and recovery. However, it is essential to prioritize safety and consult with a healthcare professional before incorporating cold exposure therapy into your routine. 2.3 Impact on the immune system. Cold exposure therapy has been found to have a significant impact on the immune system. The immune system is responsible for defending the body against harmful pathogens and maintaining overall health. By subjecting the body to cold temperatures, cold exposure therapy can stimulate and strengthen the immune system, leading to various health benefits. One of the primary ways in which cold exposure affects the immune system is by increasing the production of white blood cells. White blood cells are crucial for fighting off infections and diseases. Cold exposure has been shown to increase the number of white blood cells in the body, particularly lymphocytes and neutrophils. These cells play a vital role in immune response and help to identify and destroy harmful pathogens. Cold exposure therapy also enhances the activity of natural killer NK cells. NK cells are a type of white blood cell that plays a critical role in the body's defense against viruses and cancer cells. Studies have shown that cold exposure can increase the activity and effectiveness of NK cells, leading to improved immune function. Furthermore, cold exposure therapy has been found to modulate the production of cytokines, which are small proteins that regulate immune responses. Cold exposure can increase the production of anti-inflammatory cytokines while reducing the production of pro-inflammatory cytokines. This balance is essential for maintaining a healthy immune system and preventing chronic inflammation, which is associated with various diseases. In addition to these direct effects on immune cells and cytokines, cold exposure therapy also activates the body's stress response. When exposed to cold temperatures, the body releases stress hormones such as adrenaline and cortisol. These hormones not only help the body adapt to the cold but also have immunomodulatory effects. They can enhance immune cell function and improve the body's ability to fight off infections. Research has shown that cold exposure therapy can improve immune function and reduce the risk of respiratory tract infections. A study published in the International Journal of Circumpolar Health found that regular cold water swimming significantly reduced the incidence of common colds and respiratory infections. Participants who engaged in cold water swimming had fewer sick days and reported improved overall health compared to those who did not engage in cold exposure. Furthermore, cold exposure therapy has been found to have potential benefits for individuals with autoimmune diseases. Autoimmune diseases occur when the immune system mistakenly attacks healthy cells and tissues. Cold exposure therapy can help regulate the immune system and reduce the activity of autoimmune responses. It has been suggested that cold exposure may help alleviate symptoms and improve the quality of life for individuals with autoimmune conditions such as rheumatoid arthritis and multiple sclerosis. It is important to note that while cold exposure therapy can have positive effects on the immune system, it should be approached with caution, especially for individuals with certain health conditions. Cold exposure therapy may not be suitable for individuals with compromised immune systems, such as those undergoing chemotherapy or with severe autoimmune diseases. It is always recommended to consult with a healthcare professional before starting any new therapy or treatment. In conclusion, cold exposure therapy has a significant impact on the immune system. It can enhance immune cell function, increase the production of white blood cells, modulate cytokine production, and activate the body's stress response. These effects contribute to improved immune function, reduced risk of respiratory infections, and potential benefits for individuals with autoimmune diseases. However, it is essential to approach cold exposure therapy with caution and seek guidance from a healthcare professional to ensure its suitability for individual circumstances. 2.4 Cold exposure and inflammation. Inflammation is a natural response of the body's immune system to protect against injury, infection, or foreign substances. While acute inflammation is a necessary and beneficial process, chronic inflammation can have detrimental effects on our health. It has been found that cold exposure therapy can play a significant role in reducing inflammation and promoting overall well-being. Cold exposure has been shown to have anti-inflammatory effects on the body. When exposed to cold temperatures, the blood vessels constrict, reducing blood flow to the affected area. This constriction helps to decrease the release of inflammatory substances and reduce swelling and pain. Additionally, cold exposure can also decrease the production of pro-inflammatory cytokines, which are molecules that play a key role in the inflammatory response. One of the ways cold exposure therapy reduces inflammation is by activating the body's natural anti-inflammatory response. Cold exposure stimulates the release of anti-inflammatory cytokines, such as interleukin-10, IL-10, which helps to counteract the effects of pro-inflammatory cytokines. This balance between pro-inflammatory and anti-inflammatory cytokines is crucial for maintaining a healthy immune system and preventing chronic inflammation. Cold exposure therapy has been found to be particularly effective in reducing inflammation in conditions such as arthritis. Studies have shown that cold therapy, including cold packs and cold water immersion, can help alleviate joint pain and inflammation in individuals with rheumatoid arthritis and osteoarthritis. The cold temperature helps to numb the area and reduce swelling, providing relief from pain and discomfort. In addition to its direct effects on inflammation, cold exposure therapy can also indirectly impact inflammation by improving overall health and immune function. Regular cold exposure has been shown to enhance the body's antioxidant defense system, which helps to neutralize harmful free radicals and reduce oxidative stress. Oxidative stress is a key contributor to chronic inflammation and various health conditions, including cardiovascular disease, diabetes, and cancer. Furthermore, cold exposure therapy has been found to modulate the immune system, leading to a more balanced and regulated inflammatory response. Cold exposure stimulates the production of white blood cells, including lymphocytes and neutrophils, which are essential for immune function. These immune cells help to regulate the inflammatory response and prevent excessive inflammation. Cold exposure therapy can also have a positive impact on systemic inflammation. Chronic low-grade inflammation is associated with various health conditions, including metabolic syndrome, obesity, and insulin resistance. Studies have shown that cold exposure can improve insulin sensitivity and metabolic health, leading to a reduction in systemic inflammation markers such as C-reactive protein, CRP, and interleukin-6, IL-6. It is important to note that while cold exposure therapy can be beneficial for reducing inflammation, it should be approached with caution, especially for individuals with certain health conditions. It is always recommended to consult with a healthcare professional before starting any new therapy or treatment. In conclusion, cold exposure therapy has been shown to have anti-inflammatory effects on the body. By reducing the release of pro-inflammatory substances, stimulating the production of anti-inflammatory cytokines, and improving overall health and immune function, cold exposure can help alleviate inflammation and promote well-being. However, it is essential to approach cold exposure therapy safely and consult with a healthcare professional to ensure its suitability for individual circumstances. 3. Methods of cold exposure. 3.1 Cold showers and baths. Cold showers and baths are popular methods of cold exposure therapy that have been used for centuries to promote physical and mental well-being. The practice involves intentionally exposing the body to cold water, typically at temperatures below 70 degrees Fahrenheit, 21 degrees Celsius. While the idea of immersing oneself in cold water may seem uncomfortable or even daunting, the benefits of cold showers and baths are numerous and can have a profound impact on overall health. The science behind cold showers and baths. When the body is exposed to cold water, it triggers a series of physiological responses that can have positive effects on various systems within the body. One of the primary mechanisms at play is vasoconstriction, which is the narrowing of blood vessels in response to cold temperatures. This constriction helps to redirect blood flow to vital organs and tissues, improving circulation and oxygenation. Additionally, cold exposure stimulates the release of endorphins, which are natural painkillers and mood enhancers. This can lead to an immediate sense of well-being and increased mental clarity. Cold showers and baths also activate the sympathetic nervous system, which is responsible for the body's fight or flight response. This activation can boost energy levels and improve focus and alertness. Physical benefits of cold showers and baths. Cold showers and baths offer a range of physical benefits that can positively impact overall health and well-being. Here are some of the key advantages. 1. Improved immune function. Cold exposure has been shown to enhance the immune system's response by increasing the production of white blood cells and activating immune cells. This can help the body fight off infections and reduce the risk of illness. 2. Enhanced circulation. The vasoconstriction caused by cold water immersion can improve blood circulation and promote cardiovascular health. Cold showers and baths can also help to reduce inflammation and swelling in the body, aiding in the recovery of muscles and joints. 3. Increased metabolism and weight loss. Cold exposure has been found to stimulate the activation of brown adipose tissue, BAT, also known as brown fat. BAT is responsible for generating heat and burning calories, which can contribute to weight loss and improved metabolic function. 4. Muscle recovery and pain relief. Cold showers and baths are commonly used by athletes and fitness enthusiasts to aid in muscle recovery and reduce post-workout soreness. The cold water helps to reduce inflammation and swelling, providing relief from muscle pain and speeding up the recovery process. 5. Skin and hair health. Cold water can have a rejuvenating effect on the skin and hair. It helps to tighten the pores, improve skin tone, and promote a healthy glow. Cold showers can also stimulate hair follicles, leading to stronger and shinier hair. Mental and emotional benefits of cold showers and baths. In addition to the physical benefits, cold showers and baths can have a profound impact on mental and emotional well-being. Here are some of the key advantages. 1. Increased alertness and mental clarity. The shock of cold water on the body stimulates the release of adrenaline and increases oxygen intake, leading to heightened alertness and improved mental clarity. Cold showers and baths can help to wake up the mind and increase focus, making them an excellent way to start the day. 2. Stress reduction and mood enhancement. Cold exposure has been shown to activate the parasympathetic nervous system, which promotes relaxation and reduces stress levels. Cold showers and baths can help to alleviate symptoms of anxiety and depression, improve mood, and increase feelings of well-being. 3. Improved resilience and mental toughness. Regular exposure to cold water can help to build mental resilience and increase tolerance to discomfort. The practice of intentionally subjecting oneself to cold showers and baths can strengthen the mind and cultivate a sense of discipline and perseverance. 4. Better sleep quality. Taking a cold shower or bath before bed can promote better sleep quality. The drop in body temperature after exposure to cold water signals the body to prepare for sleep, leading to a more restful and rejuvenating night's sleep. Incorporating cold showers and baths into your routine. If you're interested in incorporating cold showers and baths into your daily routine, it's important to start gradually and listen to your body. Begin by ending your regular shower with a brief blast of cold water, gradually increasing the duration as you become more comfortable. You can also try taking a cold bath by filling a tub with cold water and immersing yourself for a few minutes. It's essential to note that cold exposure therapy may not be suitable for everyone, especially those with certain medical conditions or compromised immune systems. If you have any concerns or underlying health issues, it's best to consult with a healthcare professional before starting cold showers or baths. Remember to always prioritize safety and never push yourself beyond your limits. Cold exposure therapy should be a gradual and enjoyable process. With consistency and patience, you can reap the numerous physical, mental, and emotional benefits that cold showers and baths have to offer. 3.2 Ice baths and cryotherapy. Ice baths and cryotherapy are two popular methods of cold exposure therapy that have gained significant attention in recent years. These techniques involve exposing the body to extremely cold temperatures for a short period of time, with the aim of reaping various health benefits. In this section, we will explore the science behind ice baths and cryotherapy, their potential benefits, and how to safely incorporate them into your cold exposure routine. Ice baths. Ice baths, also known as cold water immersion, involve submerging the body in a tub or pool filled with icy water for a specific duration. The water temperature typically ranges from 50 to 59 degrees Fahrenheit, 10 to 15 degrees Celsius. The duration of the bath can vary, but it is generally recommended to start with shorter durations, such as 5 to 10 minutes, and gradually increase the time as your body adapts. The main physiological effect of ice baths is vasoconstriction, which is the narrowing of blood vessels in response to cold temperatures. This constriction helps reduce inflammation and swelling, making ice baths a popular choice for athletes recovering from intense workouts or injuries. The cold water also numbs the nerve endings, providing temporary pain relief. Ice baths have been shown to enhance muscle recovery by reducing muscle soreness and accelerating the removal of metabolic waste products, such as lactic acid, from the muscles. This can lead to faster recovery and improved performance in subsequent training sessions. Additionally, ice baths may help decrease exercise-induced muscle damage and inflammation, allowing athletes to train more frequently and at higher intensities. Apart from their benefits for athletes, ice baths have also been studied for their potential effects on the immune system. Cold exposure has been shown to stimulate the production of white blood cells, which play a crucial role in fighting off infections and diseases. By boosting the immune system, ice baths may help reduce the risk of illness and improve overall health. Cryotherapy. Cryotherapy is a more modern approach to cold exposure therapy that involves exposing the body to extremely cold temperatures for a short period, typically ranging from 2 to 4 minutes. This is achieved through the use of specialized cryotherapy chambers or cryosaunas, which emit cold air or nitrogen gas. The extreme cold temperatures in cryotherapy chambers can range from -200 to -300 degrees Fahrenheit, -129 to -184 degrees Celsius. During a cryotherapy session, the body is exposed to these temperatures, triggering a systemic response that affects various physiological processes. One of the primary effects of cryotherapy is vasoconstriction, similar to ice baths. The cold temperatures cause the blood vessels to constrict, which can help reduce inflammation and swelling. Cryotherapy has gained popularity among athletes and fitness enthusiasts for its potential to enhance recovery, reduce muscle soreness, and improve athletic performance. Cryotherapy has also been studied for its potential benefits in managing chronic pain conditions, such as arthritis and fibromyalgia. The extreme cold temperatures can numb the nerve endings, providing temporary pain relief. Additionally, cryotherapy may help reduce inflammation in the joints and muscles, leading to improved mobility and decreased pain. Another area of interest in cryotherapy research is its potential effects on mental health. Some studies have suggested that cryotherapy may have mood-enhancing effects, potentially reducing symptoms of depression and anxiety. The extreme cold temperatures during cryotherapy sessions may trigger the release of endorphins, which are natural mood-boosting chemicals in the brain. It is important to note that while ice baths and cryotherapy can offer various benefits, they are not suitable for everyone. Individuals with certain medical conditions, such as Raynaud's disease or cold urticaria, should avoid cold exposure therapy. Additionally, pregnant women and individuals with cardiovascular or respiratory conditions should consult with their healthcare provider before attempting ice baths or cryotherapy. When incorporating ice baths or cryotherapy into your cold exposure routine, it is crucial to start gradually and listen to your body. Begin with shorter durations and lower temperatures, and gradually increase them as your body adapts. It is also important to follow safety guidelines, such as wearing appropriate protective gear and ensuring proper supervision. In conclusion, ice baths and cryotherapy are two popular methods of cold exposure therapy that offer various physiological and potentially psychological benefits. Whether you choose to immerse yourself in an ice bath or step into a cryotherapy chamber, incorporating these techniques into your routine may help enhance recovery, reduce inflammation, and improve overall well-being. However, it is essential to approach cold exposure therapy with caution, considering individual health conditions and following safety guidelines. 3.3 Outdoor cold exposure. Outdoor cold exposure is a powerful and invigorating method of practicing cold exposure therapy. It involves intentionally exposing oneself to cold temperatures in an outdoor environment, such as cold weather, icy water, or snow. This form of cold exposure can provide unique benefits and challenges compared to other methods, making it a popular choice for those seeking to push their limits and experience the full range of cold exposure benefits. Embracing nature's cold. Outdoor cold exposure allows individuals to immerse themselves in the natural elements and experience the raw power of cold weather. Whether it's taking a walk in freezing temperatures, going for a winter swim, or engaging in winter sports, being outdoors in the cold can be a transformative experience. The combination of cold air, wind, and natural surroundings creates a unique sensory experience that can awaken the senses and provide a profound connection to nature. Benefits of outdoor cold exposure. Increased mental resilience. Outdoor cold exposure challenges individuals to face discomfort and adapt to adverse conditions. This can help build mental resilience, as it requires pushing through discomfort and embracing the cold. Over time, this can translate into increased mental toughness and the ability to handle stressful situations more effectively. Enhanced immune function. Exposure to cold temperatures can stimulate the immune system, leading to increased production of white blood cells and other immune cells. This can strengthen the immune system's ability to fight off infections and diseases, ultimately improving overall health and well-being. Improved cardiovascular health. Outdoor cold exposure can have a positive impact on cardiovascular health. When exposed to cold temperatures, blood vessels constrict, which can improve circulation and blood flow. This can enhance cardiovascular function, lower blood pressure, and improve overall heart health. Boosted metabolism and weight management. Cold exposure activates brown fat, a type of fat that generates heat to keep the body warm. This activation can increase metabolic rate and calorie expenditure, potentially aiding in weight loss and weight management efforts. Enhanced mood and mental well-being. Spending time outdoors in the cold can have a positive impact on mood and mental well-being. The release of endorphins and other feel-good neurotransmitters during cold exposure can promote feelings of happiness, reduce stress, and alleviate symptoms of depression and anxiety. Improved sleep quality. Cold exposure has been shown to improve sleep quality by promoting the release of melatonin, a hormone that regulates sleep-wake cycles. Spending time outdoors in the cold can help reset circadian rhythms and promote a more restful and rejuvenating sleep. Safety considerations. While outdoor cold exposure can be highly beneficial, it is essential to prioritize safety and take necessary precautions. Here are some guidelines to ensure a safe and enjoyable experience. Dress appropriately. Wear layers of clothing to insulate the body and protect against the cold. Opt for moisture-wicking and thermal materials to keep the body dry and warm. Don't forget to cover extremities such as hands, feet, and head. Stay hydrated. Cold temperatures can lead to increased fluid loss through respiration and sweat. Stay hydrated by drinking plenty of fluids before, during, and after outdoor cold exposure. Know your limits. Start with shorter exposure times and gradually increase duration and intensity. Listen to your body and be mindful of any signs of hypothermia or frostbite, such as shivering, numbness, or disorientation. If you experience any severe symptoms, seek immediate medical attention. Choose safe environments. Be cautious when venturing into icy waters or snowy terrains. Check weather conditions and be aware of potential hazards such as thin ice, avalanches, or extreme wind chill. Always practice cold exposure in safe and controlled environments. Seek professional guidance. If you are new to outdoor cold exposure or have any underlying health conditions, it is advisable to consult with a healthcare professional or cold exposure expert. They can provide personalized guidance and ensure that you engage in cold exposure safely. Embracing the cold. Outdoor cold exposure offers a unique and exhilarating way to practice cold exposure therapy. By immersing oneself in the natural elements and embracing the cold, individuals can experience a wide range of physical and mental benefits. However, it is crucial to approach outdoor cold exposure with caution and prioritize safety at all times. With proper preparation and gradual progression, outdoor cold exposure can become a transformative and empowering practice that enhances overall well-being and resilience. 3.4 Breathing Techniques for Cold Exposure. Breathing techniques play a crucial role in cold exposure therapy. By controlling your breath, you can enhance your body's response to cold temperatures and optimize the benefits of cold exposure. In this section, we will explore various breathing techniques that can be used in conjunction with cold exposure to maximize its effects on the body and mind. The power of breath. Breathing is an automatic process that we often take for granted. However, when it comes to cold exposure therapy, conscious control of your breath can make a significant difference. By manipulating your breath, you can influence your body's physiological response to cold, increase your tolerance to low temperatures, and improve your overall well-being. Wim Hof Method. One of the most popular breathing techniques used in cold exposure therapy is the Wim Hof Method. Developed by the renowned Dutch athlete Wim Hof, this method combines specific breathing exercises with cold exposure to enhance physical and mental performance. The Wim Hof method involves a series of deep, rhythmic breaths followed by a period of breath retention. This technique aims to increase oxygen levels in the body, alkalize the blood, and activate the sympathetic nervous system. By practicing this method regularly, individuals can improve their ability to withstand cold temperatures and experience a range of health benefits. Tumo breathing. Tumo breathing is a technique derived from Tibetan Buddhist practices. It involves a combination of deep breathing, visualization, and meditation. Tumo breathing aims to generate inner heat and increase body temperature, making it an excellent complement to cold exposure therapy. During Tumo breathing, individuals focus on inhaling deeply through the nose and exhaling slowly through the mouth. This technique helps to activate the body's energy centers and promote a sense of warmth and relaxation. By incorporating Tumo breathing into your cold exposure routine, you can enhance your body's ability to adapt to cold temperatures and experience a deeper sense of calm and tranquility. Box breathing. Box breathing, also known as square breathing, is a simple yet effective technique that can be used during cold exposure therapy. This technique involves inhaling, holding the breath, exhaling, and holding the breath again, all for equal durations. To practice box breathing, start by inhaling deeply through your nose for a count of 4. Then, hold your breath for a count of 4. Exhale slowly through your mouth for a count of 4, and once again, hold your breath for a count of 4. Repeat this cycle several times during your cold exposure session. Box breathing helps to regulate your heart rate, calm the mind, and increase focus and concentration. By incorporating this technique into your cold exposure practice, you can enhance your ability to withstand the cold and experience a greater sense of control over your body's response to low temperatures. Pranayama techniques. Pranayama, a Sanskrit term meaning extension of the life force, refers to various breathing techniques used in yoga. These techniques can be beneficial when combined with cold exposure therapy. One pranayama technique that can be particularly useful is Kapalabhati, also known as skull shining breath. This technique involves forceful exhalations through the nose while keeping the inhalations passive. Kapalabhati helps to increase oxygenation, clear the mind, and energize the body. By practicing this technique before or during cold exposure, you can enhance your body's ability to adapt to the cold and experience a greater sense of vitality. Integrating breathing techniques with cold exposure. To incorporate breathing techniques into your cold exposure practice, start by finding a comfortable and quiet space where you can focus on your breath. Begin with a few minutes of deep, diaphragmatic breathing to relax your body and prepare for the cold exposure. Once you are ready, begin practicing your chosen breathing technique while gradually exposing yourself to the cold. Whether you are taking a cold shower, immersing yourself in an ice bath, or venturing outdoors in cold weather, maintain your focus on your breath throughout the experience. By combining breathing techniques with cold exposure, you can enhance your body's response to the cold, increase your tolerance to low temperatures, and experience a range of physical and mental benefits. Remember to start slowly and gradually increase the intensity and duration of your cold exposure sessions over time. In the next section, we will explore the psychological benefits of cold exposure and how it can improve mental resilience, focus, and stress reduction. 4. Psychological benefits of cold exposure. 4.1 Mental resilience in cold exposure. Cold exposure therapy is not only beneficial for physical health but also has a profound impact on mental resilience. The practice of subjecting oneself to cold temperatures can help individuals develop a stronger mindset, enhance their ability to cope with stress, and improve their overall mental well-being. Building mental resilience. One of the key benefits of cold exposure therapy is its ability to build mental resilience. When exposed to cold temperatures, the body experiences a stress response, triggering the release of stress hormones like adrenaline and cortisol. This stress response can be seen as a controlled form of stress that allows individuals to adapt and become more resilient over time. By regularly exposing themselves to cold temperatures, individuals can gradually increase their tolerance and adaptability to stress. This process helps them develop mental resilience, enabling them to better handle challenging situations in their daily lives. Cold exposure therapy acts as a training ground for the mind, teaching it to remain calm and composed even in the face of discomfort. Strengthening the mind-body connection. Cold exposure therapy also strengthens the mind-body connection. When exposed to cold temperatures, individuals must rely on their mental strength to endure the discomfort. This practice encourages individuals to become more aware of their thoughts and emotions, allowing them to develop a deeper understanding of their mind-body connection. As individuals push through the discomfort of cold exposure, they learn to control their thoughts and focus their attention on the present moment. This mindfulness practice can have a profound impact on mental well-being, reducing anxiety and promoting a sense of calmness. By strengthening the mind-body connection, cold exposure therapy helps individuals develop a greater sense of self-awareness and emotional resilience. Stress reduction and cold exposure. Cold exposure therapy has been shown to be an effective tool for stress reduction. When exposed to cold temperatures, the body releases endorphins, which are natural mood-boosting chemicals. These endorphins help alleviate stress and promote a sense of relaxation and well-being. Additionally, cold exposure triggers the activation of the parasympathetic nervous system, which is responsible for the body's rest and digest response. This activation helps counterbalance the effects of the sympathetic nervous system, which is responsible for the body's fight or flight response to stress. By promoting the activation of the parasympathetic nervous system, cold exposure therapy helps individuals achieve a state of calmness and relaxation, reducing stress levels and improving overall mental health. Mental clarity and focus. Cold exposure therapy has also been found to enhance mental clarity and focus. When exposed to cold temperatures, the body releases norepinephrine, a neurotransmitter that plays a crucial role in attention and focus. This release of norepinephrine helps individuals sharpen their cognitive abilities and improve their concentration. Furthermore, the discomfort experienced during cold exposure requires individuals to stay present and focused on the task at hand. This practice of maintaining focus in the face of discomfort can translate into other areas of life, improving productivity and performance. Cold exposure therapy acts as a mental training tool, helping individuals develop the ability to concentrate and stay focused even in challenging situations. Boosting mood and well-being. Cold exposure therapy has been shown to have a positive impact on mood and overall well-being. The release of endorphins during cold exposure not only helps reduce stress but also promotes feelings of happiness and euphoria. These mood-enhancing effects can have a lasting impact on mental health, improving overall mood and well-being. Moreover, cold exposure therapy has been found to increase the production of serotonin, a neurotransmitter that plays a crucial role in regulating mood. Higher levels of serotonin are associated with improved mood, reduced anxiety, and increased feelings of happiness. By promoting the production of serotonin, cold exposure therapy can help individuals experience a greater sense of well-being and emotional balance. In conclusion, cold exposure therapy is not only beneficial for physical health but also has significant positive effects on mental resilience. By subjecting oneself to cold temperatures, individuals can build mental resilience, strengthen the mind-body connection, reduce stress, enhance mental clarity and focus, and boost mood and overall well-being. Incorporating cold exposure therapy into a daily routine can be a powerful tool for improving mental health and developing a stronger mindset. 4.2 Improved focus and concentration. Cold exposure therapy has been found to have a significant impact on improving focus and concentration. When the body is exposed to cold temperatures, it triggers a series of physiological responses that can enhance cognitive function and mental clarity. One of the primary ways cold exposure therapy improves focus and concentration is through the activation of the sympathetic nervous system. When the body is exposed to cold, the sympathetic nervous system is stimulated, leading to the release of norepinephrine, a neurotransmitter that plays a crucial role in attention and focus. Norepinephrine increases alertness and enhances cognitive performance, allowing individuals to concentrate better on tasks at hand. Furthermore, cold exposure therapy has been shown to increase blood flow to the brain. When the body is exposed to cold temperatures, blood vessels constrict, redirecting blood flow to vital organs, including the brain. This increased blood flow delivers more oxygen and nutrients to the brain, promoting optimal brain function. As a result, individuals experience improved mental clarity, enhanced memory, and increased ability to focus on complex tasks. In addition to the physiological effects, cold exposure therapy also has psychological benefits that contribute to improved focus and concentration. Cold exposure can be mentally challenging, requiring individuals to stay present and focused on their breath and body sensations. This practice of mindfulness during cold exposure sessions can translate into improved focus and concentration in other areas of life. By training the mind to stay present and focused during uncomfortable situations, individuals develop the ability to concentrate better on tasks and maintain attention for longer periods. Cold exposure therapy also helps to reduce stress and anxiety, which can significantly impact focus and concentration. When the body is exposed to cold, it triggers the release of endorphins, which are natural mood enhancers and stress reducers. By reducing stress levels, individuals can better manage distractions and maintain a clear and focused mind. Moreover, cold exposure therapy promotes the release of dopamine, a neurotransmitter associated with motivation and reward. Dopamine plays a crucial role in regulating attention and focus. When dopamine levels are balanced, individuals experience improved cognitive function, increased motivation, and enhanced ability to concentrate on tasks. Another way cold exposure therapy improves focus and concentration is by promoting better sleep quality. Cold exposure has been shown to regulate sleep patterns and improve sleep efficiency. When individuals get sufficient and restful sleep, they wake up feeling refreshed and energized, which directly impacts their ability to focus and concentrate throughout the day. It is important to note that the benefits of improved focus and concentration from cold exposure therapy are not limited to the duration of the cold exposure session. Research suggests that regular practice of cold exposure can lead to long-term improvements in cognitive function. By consistently challenging the body and mind through cold exposure, individuals can develop resilience and adaptability, which can translate into improved focus and concentration in various aspects of life. To incorporate cold exposure therapy for improved focus and concentration, it is recommended to start with shorter exposure times and gradually increase the duration as tolerance builds. Cold showers or baths are an accessible and effective method to begin with. Start by exposing the body to cold water for a few seconds and gradually increase the time over several weeks. It is essential to listen to your body and not push beyond your limits. In conclusion, cold exposure therapy has been shown to have a positive impact on improving focus and concentration. The physiological responses triggered by cold exposure, such as the activation of the sympathetic nervous system and increased blood flow to the brain, contribute to enhanced cognitive function. Additionally, the psychological benefits of reduced stress, increased dopamine release, and improved sleep quality further support improved focus and concentration. By incorporating cold exposure therapy into a regular routine and gradually increasing exposure times, individuals can experience the long-term benefits of improved cognitive function and mental clarity. 4.3 Stress reduction and cold exposure. Stress has become a prevalent issue in today's fast-paced and demanding world. From work pressures to personal responsibilities, stress can take a toll on our mental and physical well-being. Fortunately, cold exposure therapy has emerged as a promising method for stress reduction. In this section, we will explore how cold exposure can help alleviate stress and promote a sense of calm and relaxation. The stress response and cold exposure. Before delving into the benefits of cold exposure for stress reduction, it is essential to understand the stress response and how it affects our bodies. When we encounter a stressful situation, our bodies release stress hormones such as cortisol and adrenaline, preparing us for a fight or flight response. While this response is crucial in dangerous situations, chronic stress can have detrimental effects on our health. Cold exposure therapy works by activating the body's natural stress response in a controlled and beneficial way. When exposed to cold temperatures, our bodies perceive it as a stressor and initiate a physiological response. This response triggers the release of endorphins, which are natural painkillers and mood enhancers. Additionally, cold exposure stimulates the production of norepinephrine, a neurotransmitter that helps regulate stress and mood. Cold exposure and the relaxation response. One of the key benefits of cold exposure therapy is its ability to induce the relaxation response. The relaxation response is the opposite of the stress response and promotes a state of calm and relaxation. Cold exposure triggers the release of endorphins, which not only reduce pain but also create a sense of euphoria and well-being. This natural high can help counteract the negative effects of stress and promote a more positive mindset. Moreover, cold exposure has been found to activate the parasympathetic nervous system, which is responsible for the body's rest and digest functions. This activation leads to a decrease in heart rate, blood pressure, and muscle tension, promoting a state of deep relaxation. By regularly exposing ourselves to cold temperatures, we can train our bodies to respond more effectively to stress and maintain a greater sense of calm in our daily lives. Cold exposure and stress hormone regulation. Another way in which cold exposure therapy helps reduce stress is by regulating stress hormone levels. Chronic stress can lead to an imbalance in stress hormone production, resulting in heightened anxiety and a compromised immune system. Cold exposure has been shown to modulate the release of stress hormones, helping to restore balance and reduce the negative impact of stress on our bodies. Research has demonstrated that cold exposure can decrease cortisol levels, the primary stress hormone, and increase the production of dopamine and serotonin, neurotransmitters associated with feelings of happiness and well-being. By rebalancing these hormone levels, cold exposure therapy can help alleviate stress and improve overall mental health. Cold exposure and mindfulness. In addition to its physiological effects, cold exposure therapy can also promote mindfulness, which is a powerful tool for stress reduction. When exposed to cold temperatures, our bodies and minds are forced to be fully present in the moment. The intense sensation of cold requires us to focus on our breath and bodily sensations, creating a state of mindfulness. Practicing mindfulness during cold exposure can help shift our attention away from stressors and worries, allowing us to experience a sense of calm and clarity. By immersing ourselves in the present moment, we can break free from the cycle of stress and cultivate a greater sense of peace and well-being. Incorporating cold exposure into your stress reduction routine. If you are interested in using cold exposure therapy as a tool for stress reduction, it is essential to approach it gradually and safely. Start by incorporating short cold showers or baths into your daily routine, gradually increasing the duration and intensity over time. You can also explore outdoor cold exposure activities such as winter swimming or cold water immersion. It is important to listen to your body and pay attention to any signs of discomfort or excessive stress. If you have any underlying health conditions or concerns, it is advisable to consult with a healthcare professional before starting cold exposure therapy. In conclusion, cold exposure therapy offers a unique and effective approach to stress reduction. By activating the body's natural stress response and promoting the relaxation response, cold exposure can help alleviate stress, improve mood, and enhance overall well-being. Incorporating cold exposure into your stress reduction routine can provide a powerful tool for managing the demands of modern life and finding greater balance and tranquility. 4.4 Cold exposure and mood enhancement. Cold exposure therapy has been gaining attention for its potential to enhance mood and improve mental well-being. While the physiological benefits of cold exposure are well documented, its impact on mood and emotional health is equally significant. In this section, we will explore how cold exposure can positively influence mood and provide practical tips for incorporating it into your daily routine. The science behind cold exposure and mood enhancement. Cold exposure triggers a series of physiological responses in the body, including the release of endorphins and other mood-enhancing neurotransmitters. Endorphins are natural chemicals produced by the body that act as painkillers and mood boosters. When exposed to cold temperatures, the body releases a surge of endorphins, leading to feelings of euphoria and improved mood. Additionally, cold exposure stimulates the production of norepinephrine, a neurotransmitter that plays a crucial role in regulating mood and attention. Norepinephrine is known to increase focus, alertness, and overall cognitive function. By increasing the levels of norepinephrine in the brain, cold exposure can help alleviate symptoms of depression, anxiety, and stress. Furthermore, cold exposure has been found to activate the parasympathetic nervous system, which is responsible for promoting relaxation and reducing stress. This activation leads to a decrease in cortisol levels, the hormone associated with stress, and an increase in serotonin, a neurotransmitter that contributes to feelings of happiness and well-being. Cold exposure techniques for mood enhancement. Cold showers. Taking cold showers is a simple and accessible way to incorporate cold exposure into your daily routine. Start by gradually reducing the temperature of your shower over time, allowing your body to adapt to the cold. Cold showers can invigorate the mind, increase alertness, and boost mood. Ice baths and cryotherapy. Ice baths involve immersing your body in cold water, typically with ice added. Cryotherapy, on the other hand, involves exposing the body to extremely cold temperatures in a specialized chamber. Both methods can provide a powerful mood-enhancing effect by triggering the release of endorphins and reducing inflammation. Outdoor cold exposure. Spending time outdoors in cold weather can offer a unique opportunity for cold exposure. Engaging in activities such as winter sports, hiking, or simply taking a walk in chilly weather can provide the benefits of cold exposure while also connecting with nature, which has its own positive impact on mood. Breathing techniques. Certain breathing techniques, such as Wim Hof method, combine controlled breathing exercises with cold exposure. This combination has been shown to improve mood, increase energy levels, and reduce symptoms of anxiety and depression. These techniques involve deep breathing exercises and gradually exposing the body to cold temperatures. Practical tips for incorporating cold exposure into your routine. Start gradually. If you are new to cold exposure, it is important to start slowly and allow your body to adapt. Begin with shorter durations of exposure and gradually increase the time and intensity as your tolerance improves. Consistency is key. To experience the mood-enhancing benefits of cold exposure, it is important to make it a regular part of your routine. Aim for daily or several times a week sessions to maximize the positive effects. Find what works for you. Experiment with different cold exposure methods to find the ones that resonate with you the most. Whether it's cold showers, ice baths, or outdoor activities, choose the techniques that you enjoy and feel comfortable with. Combine with other mood-enhancing practices. Cold exposure can be even more effective when combined with other mood-enhancing practices such as meditation, exercise, and a healthy lifestyle. Consider incorporating these practices into your routine to amplify the positive effects on mood. Listen to your body. Pay attention to how your body responds to cold exposure. If you experience any discomfort or adverse effects, adjust the duration or intensity accordingly. It's important to prioritize your safety and well-being throughout the process. In conclusion, cold exposure therapy has the potential to enhance mood and improve mental well-being. By triggering the release of endorphins, increasing norepinephrine levels, and activating the parasympathetic nervous system, cold exposure can positively influence mood and alleviate symptoms of depression, anxiety, and stress. By incorporating cold exposure techniques into your daily routine and following the practical tips provided, you can harness the mood-enhancing benefits of cold exposure and improve your overall emotional well-being. 5. Cold exposure for physical performance. 5.1 Cold exposure and athletic performance. Cold exposure therapy has gained significant attention in recent years for its potential benefits in enhancing athletic performance. Athletes from various sports disciplines have started incorporating cold exposure techniques into their training routines to gain a competitive edge. This section explores the relationship between cold exposure and athletic performance, highlighting the physiological mechanisms and practical applications. The impact of cold exposure on athletic performance. Cold exposure has been shown to have several positive effects on athletic performance. One of the key benefits is its ability to improve recovery and reduce muscle soreness. Intense physical activity can lead to muscle damage and inflammation, resulting in delayed recovery and decreased performance. Cold exposure, such as ice baths or cryotherapy, can help alleviate these symptoms by reducing inflammation and promoting faster muscle repair. Furthermore, cold exposure can enhance endurance performance. When exposed to cold temperatures, the body activates a process called cold-induced thermogenesis, which generates heat to maintain core body temperature. This increased heat production can lead to improved endurance capacity, allowing athletes to perform at a higher intensity for longer durations. Cold exposure also has a positive impact on strength and power. Studies have shown that exposure to cold temperatures can increase muscle activation and force production, leading to improved strength and power output. This effect can be particularly beneficial for athletes involved in explosive movements, such as sprinting, jumping, and weightlifting. Practical applications for athletes. Athletes can incorporate cold exposure into their training routines in various ways to optimize their performance. Here are some practical applications. Post-exercise recovery. After intense training sessions or competitions, athletes can benefit from cold exposure to enhance recovery. Taking an ice bath or using cryotherapy can help reduce muscle soreness, inflammation, and swelling. The cold temperature constricts blood vessels, reducing blood flow to the affected muscles and minimizing the accumulation of metabolic waste products. This process promotes faster recovery and prepares the body for subsequent training sessions. Pre-exercise warm-up. Contrary to traditional warm-up methods, recent research suggests that incorporating cold exposure before exercise can enhance performance. Cold exposure activates the sympathetic nervous system, increasing adrenaline release and stimulating the body's fight or flight response. This physiological response can lead to improved focus, alertness, and readiness for physical exertion. Athletes can use cold showers or cold packs on specific muscle groups as part of their warm-up routine. Interval training. Interval training involves alternating between high-intensity exercise and periods of rest or low-intensity activity. Cold exposure can be integrated into interval training to enhance its benefits. Athletes can perform high-intensity exercises in a cold environment, such as a cold room or outdoors in cold weather. The cold temperature amplifies the physiological stress response, leading to greater adaptations and improvements in performance. Contrast therapy. Contrast therapy involves alternating between hot and cold exposures. Athletes can use contrast showers or contrast baths, alternating between hot and cold water, to enhance recovery and performance. The hot water increases blood flow, promoting nutrient delivery and waste removal, while the cold water reduces inflammation and muscle soreness. This alternating effect can improve circulation, enhance recovery, and prepare the body for subsequent training or competition. Considerations and safety precautions. While cold exposure can be beneficial for athletic performance, it is essential to consider individual factors and safety precautions. Athletes should gradually introduce cold exposure into their training routines to allow the body to adapt. Sudden and extreme cold exposure can lead to adverse reactions, such as hypothermia or frostbite. It is also crucial to monitor the duration and intensity of cold exposure. Prolonged exposure to extreme cold temperatures can have detrimental effects on performance and health. Athletes should consult with a healthcare professional or a qualified cold exposure specialist to determine the appropriate duration and intensity for their specific needs. In conclusion, cold exposure therapy can have a positive impact on athletic performance. It can enhance recovery, improve endurance, and increase strength and power. Athletes can incorporate cold exposure techniques such as ice baths, cryotherapy, and contrast therapy into their training routines to optimize their performance. However, it is essential to consider individual factors and safety precautions to ensure the benefits of cold exposure are maximized while minimizing the risks. 5.2 Muscle recovery and cold exposure. Cold exposure therapy has gained popularity not only for its physiological benefits but also for its potential to aid in muscle recovery. Athletes and fitness enthusiasts have started incorporating cold exposure techniques into their post-workout routines to enhance recovery and optimize performance. In this section, we will explore the relationship between cold exposure and muscle recovery, and how it can benefit individuals seeking to improve their athletic performance. The science behind muscle recovery. Before delving into the specific benefits of cold exposure for muscle recovery, it is essential to understand the science behind the recovery process. When we engage in physical activity, our muscles undergo stress and micro-tears, leading to inflammation and soreness. The body then initiates a series of processes to repair and rebuild the damaged muscle fibers, resulting in muscle growth and increased strength. One crucial aspect of muscle recovery is reducing inflammation. Inflammation is a natural response to tissue damage, but excessive or prolonged inflammation can impede the recovery process and lead to delayed healing. Therefore, finding effective methods to manage inflammation is crucial for optimizing muscle recovery. Cold exposure and inflammation reduction. Cold exposure has been shown to have anti-inflammatory effects, making it a valuable tool for muscle recovery. When exposed to cold temperatures, blood vessels constrict, reducing blood flow to the affected area. This constriction helps minimize the release of inflammatory substances and limits the spread of inflammation. Additionally, cold exposure can help decrease the production of pro-inflammatory cytokines, which are molecules involved in the inflammatory response. By reducing the levels of these cytokines, cold exposure can help mitigate inflammation and promote faster recovery. Cryotherapy and ice baths. Two common methods of cold exposure used for muscle recovery are cryotherapy and ice baths. Cryotherapy involves exposing the body to extremely cold temperatures, typically through whole-body cryotherapy chambers or localized cryotherapy devices. Ice baths, on the other hand, involve immersing the body in cold water, usually between 50 to 59 degrees Fahrenheit, 10 to 15 degrees Celsius. Both cryotherapy and ice baths work by triggering the body's cold-induced thermogenesis response. When exposed to cold temperatures, the body activates its thermoregulatory mechanisms to generate heat and maintain core body temperature. This process increases metabolic activity, which can aid in muscle recovery by promoting blood circulation and nutrient delivery to the muscles. Benefits of cold exposure for muscle recovery. Reduced muscle soreness. Cold exposure has been shown to alleviate muscle soreness, also known as delayed onset muscle soreness (DOMS). By reducing inflammation and promoting blood flow, cold exposure can help alleviate the discomfort associated with DOMS, allowing individuals to recover faster and resume their training. Faster recovery. Cold exposure can accelerate the recovery process by enhancing the removal of metabolic waste products, such as lactic acid, from the muscles. This clearance of waste products helps reduce muscle fatigue and promotes faster recovery between workouts. Improved muscle function. Cold exposure has been found to enhance muscle function and performance. By reducing inflammation and promoting blood flow, cold exposure can help optimize muscle function, allowing individuals to perform at their best during subsequent training sessions or competitions. Prevention of muscle damage. Cold exposure may help prevent muscle damage caused by intense exercise. By reducing inflammation and limiting the release of damaging substances, cold exposure can protect muscle fibers from excessive stress and strain, reducing the risk of injury. Incorporating cold exposure into your routine. If you are interested in incorporating cold exposure into your muscle recovery routine, it is essential to do so safely and gradually. Start by incorporating shorter cold exposure sessions, such as cold showers or localized cryotherapy, and gradually increase the duration and intensity as your body adapts. It is also crucial to listen to your body and pay attention to any signs of discomfort or adverse reactions. Cold exposure should never be painful or cause prolonged discomfort. If you have any underlying health conditions or concerns, it is advisable to consult with a healthcare professional before starting cold exposure therapy. In conclusion, cold exposure therapy can be a valuable tool for muscle recovery. By reducing inflammation, promoting blood flow, and enhancing the removal of waste products, cold exposure can aid in faster recovery, reduced muscle soreness, and improved muscle function. However, it is important to approach cold exposure therapy with caution and gradually incorporate it into your routine to ensure safety and maximize its benefits. 5.3 Cold exposure and endurance. Cold exposure therapy has gained popularity not only for its physiological and psychological benefits but also for its potential to enhance endurance performance. Endurance athletes, such as runners, cyclists, and swimmers, are constantly seeking ways to improve their performance and gain a competitive edge. Cold exposure has emerged as a promising strategy to achieve these goals. The science behind cold exposure and endurance. Cold exposure stimulates the body's adaptive response, triggering a series of physiological changes that can enhance endurance performance. When exposed to cold temperatures, the body activates its thermoregulatory mechanisms to maintain core body temperature. This process involves increased blood flow to the skin and peripheral tissues, as well as the activation of brown adipose tissue (BAT). One of the key mechanisms through which cold exposure enhances endurance is by increasing mitochondrial biogenesis. Mitochondria are the powerhouses of our cells, responsible for producing energy in the form of adenosine triphosphate, ATP. Cold exposure stimulates the production of more mitochondria, improving the efficiency of energy production and utilization during exercise. This can lead to increased endurance capacity and delayed onset of fatigue. Furthermore, cold exposure has been shown to improve oxygen utilization and increase the production of red blood cells. Cold temperatures cause vasoconstriction, narrowing the blood vessels and reducing blood flow to the extremities. As a result, more oxygen-rich blood is redirected to the working muscles, improving oxygen delivery and utilization. This can enhance aerobic capacity and endurance performance. Cold exposure techniques for endurance enhancement. There are several cold exposure techniques that endurance athletes can incorporate into their training routines to reap the benefits. Here are some effective methods. Cold showers and baths. Taking cold showers or immersing yourself in a cold bath after a training session can help promote recovery and enhance endurance. The cold water reduces inflammation and muscle soreness, allowing for faster recovery between workouts. Additionally, cold showers and baths can improve blood circulation and stimulate the release of endorphins, which can enhance mood and reduce stress. Ice baths and cryotherapy. Ice baths and cryotherapy involve immersing the body in extremely cold temperatures for a short duration. These techniques are commonly used by athletes to accelerate recovery and reduce muscle damage after intense training sessions or competitions. The cold temperatures constrict blood vessels, reducing inflammation and swelling. This can help athletes recover faster and perform better in subsequent training sessions or competitions. Outdoor cold exposure. Training in cold outdoor environments can provide unique benefits for endurance athletes. Exercising in cold temperatures forces the body to work harder to maintain core body temperature, leading to increased energy expenditure and improved cardiovascular fitness. Additionally, outdoor cold exposure exposes athletes to natural elements, such as wind and uneven terrain, which can enhance balance, coordination, and overall athletic performance. Breathing techniques for cold exposure. Breathing techniques, such as Wim Hof method, can be combined with cold exposure to enhance endurance performance. These techniques involve controlled breathing exercises that increase oxygen intake and improve the body's ability to tolerate cold temperatures. By practicing these techniques, athletes can improve their lung capacity, oxygen utilization, and overall endurance capacity. Incorporating cold exposure into endurance training. To incorporate cold exposure into endurance training effectively, it is important to consider a few key factors. Gradual progression is crucial to allow the body to adapt to the cold stimulus gradually. Start with shorter durations and less intense cold exposure and gradually increase the duration and intensity over time. This will help minimize the risk of cold-related injuries and allow the body to adapt to the stress of cold exposure. It is also essential to listen to your body and prioritize safety. Cold exposure should never be taken to the extreme, and athletes should be aware of their individual limits. If you experience any adverse reactions or discomfort during cold exposure, it is important to stop and seek medical advice if necessary. In conclusion, cold exposure therapy has the potential to enhance endurance performance by improving mitochondrial biogenesis, oxygen utilization, and cardiovascular fitness. Incorporating cold showers, ice baths, outdoor training, and breathing techniques into endurance training routines can provide athletes with a competitive edge. However, it is important to approach cold exposure with caution, gradually progress, and prioritize safety to reap the full benefits without compromising health and well-being. 5.4 Cold exposure and strength training. Strength training is a popular form of exercise that focuses on building muscle strength, power, and endurance. It typically involves lifting weights or using resistance machines to challenge the muscles. While strength training is known for its ability to improve physical performance and enhance muscle growth, incorporating cold exposure into your strength training routine can provide additional benefits. The role of cold exposure in strength training. Cold exposure, such as cold showers, ice baths, or cryotherapy, can have a positive impact on strength training. When exposed to cold temperatures, the body activates various physiological responses that can enhance the effectiveness of strength training exercises. Increased muscle activation. Cold exposure has been shown to increase muscle activation during strength training. When exposed to cold temperatures, the body's natural response is to shiver, which generates heat and activates the muscles. This increased muscle activation can lead to greater muscle fiber recruitment and improved overall strength gains. Improved recovery. Intense strength training sessions can lead to muscle damage and inflammation. Cold exposure can help reduce inflammation and promote faster recovery. Cold therapy constricts blood vessels, which helps to reduce swelling and inflammation in the muscles. Additionally, cold exposure can help flush out metabolic waste products, such as lactic acid, which can accumulate during intense exercise. By reducing inflammation and promoting faster recovery, cold exposure can allow for more frequent and intense strength training sessions. Enhanced endurance. Cold exposure has been shown to improve endurance, which can be beneficial for strength training. Endurance is the ability to sustain prolonged physical activity, and it plays a crucial role in performing multiple sets and repetitions during strength training exercises. Cold exposure stimulates the production of brown fat, a type of fat that generates heat and increases energy expenditure. This increase in energy expenditure can improve endurance and allow for longer and more intense strength training sessions. Increased mental focus. Strength training requires mental focus and concentration to perform exercises correctly and safely. Cold exposure has been shown to increase alertness and mental clarity, which can enhance your ability to focus during strength training sessions. The shock of cold water or cold air can stimulate the release of adrenaline and other neurotransmitters that improve cognitive function and mental performance. Incorporating cold exposure into strength training. If you're interested in incorporating cold exposure into your strength training routine, there are several methods you can try. Cold showers. Taking cold showers after your strength training sessions can provide the benefits of cold exposure. Start by gradually reducing the temperature of the water until it becomes cold. Stay under the cold water for a few minutes to allow your body to adapt to the temperature. Cold showers can help reduce inflammation, promote recovery, and increase mental focus. Ice baths and cryotherapy. Ice baths involve immersing your body in cold water, typically with ice added, for a specific duration. Cryotherapy, on the other hand, involves exposing your body to extremely cold air for a short period. Both methods can provide the benefits of cold exposure and are commonly used by athletes and fitness enthusiasts to enhance recovery and improve performance. Cold compresses. Applying cold compresses to specific muscle groups before or after strength training can help reduce inflammation and promote recovery. You can use ice packs or cold towels to apply cold therapy to targeted areas. Outdoor cold exposure. If you live in a cold climate, you can take advantage of the natural cold temperatures for cold exposure. Engaging in outdoor activities, such as winter sports or outdoor workouts, can provide the benefits of cold exposure while also enjoying the benefits of physical activity. Safety considerations. While cold exposure can be beneficial for strength training, it's important to consider safety precautions. Gradually introduce cold exposure into your routine to allow your body to adapt to the temperature changes. Avoid prolonged exposure to extreme cold temperatures to prevent frostbite or hypothermia. Listen to your body and stop the cold exposure if you experience any adverse reactions or discomfort. If you have any pre-existing medical conditions or concerns, consult with a healthcare professional before incorporating cold exposure into your strength training routine. In conclusion, incorporating cold exposure into your strength training routine can provide additional benefits such as increased muscle activation, improved recovery, enhanced endurance, and increased mental focus. By using methods like cold showers, ice baths, or cryotherapy, you can optimize your strength training sessions and achieve better results. However, it's important to prioritize safety and gradually introduce cold exposure while listening to your body's response. 6. Cold exposure and weight loss. 6.1 Cold exposure and metabolism. Cold exposure therapy has gained significant attention in recent years due to its potential benefits for metabolism and weight loss. The concept behind this therapy is based on the idea that exposing the body to cold temperatures can stimulate various physiological responses, including an increase in metabolic rate. Metabolism refers to the complex set of chemical reactions that occur within the body to convert food into energy. It is influenced by various factors, including genetics, age, body composition, and environmental conditions. Cold exposure has been found to have a direct impact on metabolism, leading to potential benefits for weight management and overall health. One of the primary ways in which cold exposure affects metabolism is through the activation of brown fat. Brown fat, also known as brown adipose tissue (BAT), is a specialized type of fat that generates heat by burning calories. Unlike white fat, which stores energy, brown fat is metabolically active and can help regulate body temperature. Research has shown that cold exposure can increase the activity of brown fat, leading to an increase in energy expenditure. When exposed to cold temperatures, brown fat cells release a hormone called irisin, which stimulates the conversion of white fat into brown fat. This process, known as browning, can potentially enhance metabolic rate and contribute to weight loss. In addition to activating brown fat, cold exposure also stimulates the sympathetic nervous system, which plays a crucial role in regulating metabolism. The sympathetic nervous system releases norepinephrine, a hormone that promotes the breakdown of stored fat and increases energy expenditure. This can lead to an increase in the number of calories burned, even at rest. Furthermore, cold exposure has been found to improve insulin sensitivity, which is essential for maintaining stable blood sugar levels and preventing the development of insulin resistance and type 2 diabetes. Cold exposure activates certain proteins and enzymes that enhance insulin signaling, allowing cells to efficiently take up glucose from the bloodstream. This can help regulate blood sugar levels and prevent excessive fat storage. Another way in which cold exposure affects metabolism is through the activation of the hypothalamus, a region of the brain that plays a crucial role in regulating appetite and energy balance. Cold exposure has been found to increase the production of certain hormones, such as leptin and adiponectin, which help regulate hunger and satiety. By modulating these hormones, cold exposure may help control appetite and reduce food intake, contributing to weight loss. It is important to note that while cold exposure can have positive effects on metabolism, it should be used in conjunction with a healthy lifestyle that includes regular exercise and a balanced diet. Cold exposure alone is not a magic solution for weight loss but can be a valuable tool when combined with other healthy habits. When incorporating cold exposure into your routine, it is essential to start gradually and listen to your body. Begin with shorter exposure times and gradually increase the duration and intensity as your body adapts. It is also crucial to ensure safety by avoiding extreme cold temperatures and taking necessary precautions to prevent frostbite or hypothermia. In conclusion, cold exposure therapy has the potential to positively impact metabolism and contribute to weight loss. By activating brown fat, stimulating the sympathetic nervous system, improving insulin sensitivity, and regulating appetite, cold exposure can increase energy expenditure and promote a healthy metabolic rate. However, it is important to approach cold exposure as part of a comprehensive approach to weight management, including regular exercise and a balanced diet. Always consult with a healthcare professional before starting any new therapy or making significant changes to your lifestyle. 6.2 Brown fat activation and cold exposure. Cold exposure therapy has gained significant attention in recent years due to its potential benefits for weight loss and metabolic health. One of the key mechanisms behind these benefits is the activation of brown fat through cold exposure. Brown fat, also known as brown adipose tissue (BAT), is a specialized type of fat that is primarily responsible for generating heat in the body. Unlike white fat, which stores energy, brown fat burns calories to produce heat. It contains a high number of mitochondria, which are the powerhouses of cells responsible for energy production. The activation of brown fat is particularly important for weight loss because it increases the body's energy expenditure. When brown fat is activated, it burns stored fat and glucose to generate heat, leading to an increase in calorie burning. This process is known as thermogenesis. Cold exposure stimulates the activation of brown fat by triggering a process called non-shivering thermogenesis. When the body is exposed to cold temperatures, the sympathetic nervous system is activated, leading to the release of norepinephrine. Norepinephrine binds to receptors on brown fat cells, signaling them to start burning stored fat and glucose to generate heat. Research has shown that cold exposure can significantly increase brown fat activity. In a study published in the Journal of Clinical Investigation, researchers found that exposure to cold temperatures for 2 hours per day over a period of 6 weeks led to a 42% increase in brown fat activity. This increase in brown fat activity was associated with a significant reduction in body fat mass. The activation of brown fat through cold exposure not only promotes weight loss but also improves metabolic health. Brown fat has been found to play a role in regulating blood sugar levels and improving insulin sensitivity. Insulin sensitivity refers to the body's ability to effectively use insulin to regulate blood sugar levels. Improved insulin sensitivity can help prevent the development of type 2 diabetes and metabolic syndrome. Furthermore, brown fat activation has been shown to have beneficial effects on lipid metabolism. It can increase the breakdown of triglycerides, which are a type of fat found in the blood, and improve blood lipid profiles. This can lead to a decrease in levels of harmful cholesterol and triglycerides, reducing the risk of cardiovascular diseases. In addition to its metabolic benefits, brown fat activation through cold exposure has also been linked to improvements in other health markers. Research suggests that it may have anti-inflammatory effects, reducing the risk of chronic inflammation-related diseases such as cardiovascular disease, diabetes, and certain types of cancer. It is important to note that the amount of brown fat and its activation can vary among individuals. Some people naturally have more active brown fat than others. Age, sex, and body composition can also influence brown fat activity. However, even individuals with lower levels of brown fat can still benefit from cold exposure therapy. To incorporate cold exposure for brown fat activation into your routine, you can start with simple methods such as cold showers or gradually progress to more intense forms of cold exposure like ice baths or outdoor cold exposure. It is recommended to start with shorter durations and gradually increase the exposure time as your body adapts to the cold. It is important to listen to your body and not push yourself too hard. If you have any underlying health conditions or concerns, it is advisable to consult with a healthcare professional before starting cold exposure therapy. In conclusion, cold exposure therapy can activate brown fat, leading to increased calorie burning and improved metabolic health. The activation of brown fat through cold exposure has been associated with weight loss, improved insulin sensitivity, better lipid profiles, and potential anti-inflammatory effects. Incorporating cold exposure into your routine can be a valuable tool for promoting overall health and well-being. 6.3 Cold exposure and caloric expenditure. Cold exposure therapy has gained popularity not only for its numerous health benefits but also for its potential to aid in weight loss. One of the key mechanisms through which cold exposure contributes to weight loss is by increasing caloric expenditure. In this section, we will explore the relationship between cold exposure and caloric expenditure, shedding light on how exposing the body to cold temperatures can help burn more calories. The role of thermogenesis. Thermogenesis is the process by which the body generates heat. It plays a crucial role in regulating body temperature and energy expenditure. When exposed to cold temperatures, the body activates a specific type of thermogenesis called non-shivering thermogenesis, which involves the activation of brown adipose tissue (BAT). Brown fat activation. Brown adipose tissue, also known as brown fat, is a specialized type of fat that is primarily responsible for generating heat. Unlike white adipose tissue, which stores energy, brown fat burns calories to produce heat. Cold exposure stimulates the activation and recruitment of brown fat, leading to an increase in energy expenditure. Research has shown that cold exposure can significantly increase the activity of brown fat, resulting in a higher metabolic rate and greater caloric expenditure. In fact, studies have demonstrated that individuals with higher levels of brown fat tend to have a higher resting metabolic rate, indicating that they burn more calories even at rest. Cold exposure and energy expenditure. Cold exposure not only activates brown fat but also increases overall energy expenditure. When exposed to cold temperatures, the body works harder to maintain its core temperature, leading to an increase in metabolic rate. This increase in metabolic rate translates into a higher caloric expenditure. A study published in the Journal of Clinical Endocrinology and Metabolism found that exposure to cold temperatures for 2 hours per day over a period of 6 weeks resulted in a significant increase in energy expenditure. The participants in the study burned an additional 250 calories per day on average, which could potentially contribute to weight loss over time. Cold exposure and fat oxidation. In addition to increasing energy expenditure, cold exposure has been shown to enhance fat oxidation. Fat oxidation refers to the process of breaking down stored fat and using it as a fuel source. By promoting fat oxidation, cold exposure can help the body utilize its fat stores more efficiently, leading to weight loss. A study published in the Journal of Clinical Investigation investigated the effects of cold exposure on fat metabolism. The researchers found that cold exposure increased the activity of enzymes involved in fat oxidation, suggesting that cold exposure may enhance the body's ability to burn fat for energy. Cold exposure and exercise performance. Another way in which cold exposure can contribute to weight loss is by improving exercise performance. Cold exposure has been shown to enhance endurance and increase the intensity of physical activity, leading to a higher caloric expenditure during exercise. When exposed to cold temperatures, the body activates its thermoregulatory mechanisms to maintain core temperature. This process requires energy, which can lead to an increase in heart rate and oxygen consumption. As a result, individuals may experience improved cardiovascular fitness and increased calorie burn during exercise. Cold exposure and appetite control. In addition to increasing caloric expenditure, cold exposure may also help regulate appetite, which can further support weight loss efforts. Cold exposure has been shown to suppress appetite and reduce food intake, potentially leading to a calorie deficit and subsequent weight loss. Research has demonstrated that exposure to cold temperatures can activate the release of hormones, such as norepinephrine and leptin, which play a role in appetite regulation. These hormonal changes can help individuals feel more satiated and reduce cravings for high-calorie foods. Incorporating cold exposure into weight loss strategies. While cold exposure can contribute to weight loss, it is important to note that it should be used as part of a comprehensive weight loss strategy that includes a balanced diet and regular exercise. Cold exposure alone is unlikely to lead to significant weight loss without these additional lifestyle modifications. When incorporating cold exposure into a weight loss plan, it is essential to start gradually and listen to your body. Begin with shorter exposure times and gradually increase the duration and intensity of cold exposure over time. It is also important to prioritize safety and follow the guidelines outlined in Chapter 12 to minimize the risk of cold-related injuries. In conclusion, cold exposure can increase caloric expenditure through the activation of brown fat, increased energy expenditure, enhanced fat oxidation, improved exercise performance, and appetite control. By incorporating cold exposure into a comprehensive weight loss strategy, individuals may be able to enhance their calorie burn and support their weight loss goals. However, it is crucial to approach cold exposure therapy with caution and consult with a healthcare professional before starting any new therapeutic practices. 6.4 Cold exposure and appetite control. Cold exposure therapy has gained significant attention for its potential benefits in appetite control and weight management. The exposure to cold temperatures has been found to have a direct impact on appetite regulation, leading to reduced food intake and potential weight loss. In this section, we will explore the relationship between cold exposure and appetite control, as well as the underlying mechanisms that contribute to these effects. The role of brown fat activation. One of the key mechanisms through which cold exposure influences appetite control is the activation of brown fat. Brown fat, also known as brown adipose tissue (BAT), is a specialized type of fat that generates heat by burning calories. Unlike white fat, which stores energy, brown fat is metabolically active and plays a crucial role in regulating body temperature. When exposed to cold temperatures, the body activates brown fat to generate heat and maintain thermal balance. This process, known as cold-induced thermogenesis, increases energy expenditure and can lead to weight loss. Additionally, the activation of brown fat has been shown to enhance insulin sensitivity and improve glucose metabolism, which can further contribute to appetite control and weight management. Cold exposure and hormonal regulation. Cold exposure also influences appetite control through its effects on hormonal regulation. When exposed to cold temperatures, the body releases certain hormones that can suppress appetite and reduce food intake. One of these hormones is leptin, which is produced by fat cells and plays a crucial role in regulating energy balance. Leptin acts on the hypothalamus, a region of the brain involved in appetite regulation, to decrease appetite and increase energy expenditure. Cold exposure has been found to increase leptin levels, leading to reduced hunger and increased satiety. This hormonal response to cold exposure can help individuals better control their food intake and make healthier dietary choices. Another hormone affected by cold exposure is ghrelin, often referred to as the hunger hormone. Ghrelin is primarily produced in the stomach and stimulates appetite. Studies have shown that cold exposure can decrease ghrelin levels, resulting in reduced hunger and food cravings. By modulating the levels of these appetite-regulating hormones, cold exposure can help individuals achieve better appetite control and support weight management efforts. Cold exposure and metabolic rate. In addition to its effects on brown fat activation and hormonal regulation, cold exposure can also influence metabolic rate, which plays a crucial role in appetite control. When exposed to cold temperatures, the body increases its metabolic rate to generate heat and maintain body temperature. This increase in metabolic rate leads to higher energy expenditure, which can contribute to weight loss. Furthermore, cold exposure has been found to enhance the utilization of stored fat as a fuel source. As the body tries to generate heat, it relies more on fat stores for energy, which can lead to a reduction in body fat percentage over time. By increasing metabolic rate and promoting fat utilization, cold exposure can support appetite control and weight management efforts. Practical applications. Incorporating cold exposure into your daily routine can be an effective strategy for appetite control and weight management. Here are some practical tips to consider. Cold showers. Start your day with a cold shower to stimulate brown fat activation and increase metabolic rate. This can help kickstart your metabolism and promote appetite control throughout the day. Outdoor activities. Engage in outdoor activities during colder weather to expose yourself to lower temperatures. This can be as simple as going for a walk or jog in cooler temperatures, which can help activate brown fat and regulate appetite. Cold water immersion. Consider incorporating cold water immersion techniques, such as ice baths or cold water swimming, into your routine. These methods can provide a more intense cold exposure experience and further enhance the benefits of appetite control. Gradual progression. When starting cold exposure therapy, it is important to gradually expose yourself to colder temperatures to allow your body to adapt. Begin with shorter durations and gradually increase the exposure time as your tolerance improves. Safety precautions. Always prioritize your safety when practicing cold exposure therapy. Avoid extreme cold temperatures and listen to your body's signals. If you have any underlying health conditions or concerns, consult with a healthcare professional before starting cold exposure therapy. In conclusion, cold exposure therapy can have a significant impact on appetite control and weight management. Through the activation of brown fat, hormonal regulation, and increased metabolic rate, cold exposure can help individuals better regulate their food intake and support their weight loss goals. By incorporating cold exposure techniques into your daily routine and following safety guidelines, you can harness the potential benefits of cold exposure for appetite control and overall well-being. 7. Cold exposure and sleep. 7.1 Cold exposure and sleep quality. Sleep is a fundamental aspect of our overall well-being, and its quality directly impacts our physical and mental health. In today's fast-paced and stressful world, many individuals struggle with sleep-related issues such as insomnia, sleep disorders, and poor sleep quality. However, recent research has shown that cold exposure therapy can have a positive impact on sleep quality and help individuals achieve a more restful and rejuvenating sleep. The role of cold exposure in sleep regulation. Cold exposure therapy involves exposing the body to cold temperatures for a specific duration. This exposure can be achieved through various methods such as cold showers, ice baths, or sleeping in a cool environment. When it comes to sleep, cold exposure has been found to influence the body's natural sleep-wake cycle, also known as the circadian rhythm. The circadian rhythm is regulated by the body's internal clock, which is influenced by external factors such as light and temperature. Exposure to cold temperatures can help regulate the circadian rhythm by promoting the release of melatonin, a hormone that plays a crucial role in sleep regulation. Melatonin is typically released in response to darkness and helps signal to the body that it is time to sleep. Cold exposure can enhance the production and release of melatonin, leading to improved sleep quality. Cold exposure and insomnia. Insomnia is a common sleep disorder characterized by difficulty falling asleep, staying asleep, or experiencing non-restorative sleep. It can have a significant impact on an individual's overall well-being and quality of life. Cold exposure therapy has shown promising results in alleviating insomnia symptoms and improving sleep quality. One study conducted on individuals with chronic insomnia found that cold exposure therapy significantly reduced the time it took for participants to fall asleep and increased their total sleep time. The exposure to cold temperatures helped calm the mind and relax the body, making it easier for individuals to transition into a restful sleep state. Additionally, cold exposure therapy has been found to decrease the frequency of nighttime awakenings, allowing individuals to experience more uninterrupted sleep. Cold exposure and sleep disorders. Sleep disorders such as sleep apnea and restless leg syndrome can significantly disrupt sleep patterns and lead to poor sleep quality. Cold exposure therapy has shown potential in managing these sleep disorders and improving overall sleep health. Sleep apnea is a condition characterized by pauses in breathing during sleep, often accompanied by loud snoring. Cold exposure therapy can help reduce the severity of sleep apnea symptoms by promoting better airflow and reducing inflammation in the airways. By exposing the body to cold temperatures, the airways can constrict, reducing the likelihood of obstruction and improving breathing during sleep. Restless leg syndrome (RLS) is a neurological disorder characterized by an uncontrollable urge to move the legs, often accompanied by uncomfortable sensations. RLS can significantly disrupt sleep and lead to daytime fatigue. Cold exposure therapy has been found to alleviate RLS symptoms by reducing the sensations of discomfort and promoting relaxation. By incorporating cold exposure into their bedtime routine, individuals with RLS may experience improved sleep quality and reduced symptoms. Cold exposure and circadian rhythm. The circadian rhythm plays a vital role in regulating sleep-wake cycles and maintaining a healthy sleep pattern. Disruptions to the circadian rhythm, such as jet lag or shift work, can lead to sleep disturbances and a decrease in overall sleep quality. Cold exposure therapy can help regulate the circadian rhythm and promote a more consistent sleep-wake cycle. Exposure to cold temperatures in the morning can help reset the body's internal clock and promote wakefulness. Cold showers or immersions in cold water stimulate the body, increase alertness, and signal to the brain that it is time to be awake. Conversely, exposure to cold temperatures in the evening can help prepare the body for sleep by promoting the release of melatonin and signaling the onset of nighttime. Conclusion. Sleep is a vital component of our overall health and well-being, and poor sleep quality can have a significant impact on our daily lives. Cold exposure therapy has emerged as a promising approach to improving sleep quality and managing sleep-related issues. By incorporating cold exposure into our daily routines, we can regulate our circadian rhythm, alleviate insomnia symptoms, manage sleep disorders, and promote a more restful and rejuvenating sleep. However, it is essential to consult with a healthcare professional before starting any cold exposure therapy, especially for individuals with pre-existing health conditions. 7.2 Cold exposure and insomnia. Insomnia is a common sleep disorder characterized by difficulty falling asleep, staying asleep, or experiencing non-restorative sleep. It can have a significant impact on a person's overall well-being, affecting their mood, energy levels, and cognitive function. While there are various treatment options available for insomnia, cold exposure therapy has emerged as a potential complementary approach to improve sleep quality. The link between cold exposure and insomnia. Research suggests that cold exposure therapy may have a positive impact on insomnia by promoting better sleep patterns and enhancing sleep quality. Cold exposure triggers a series of physiological responses in the body, including the release of certain hormones and neurotransmitters that can influence sleep. One of the key mechanisms through which cold exposure may improve sleep is by regulating the body's circadian rhythm. The circadian rhythm is the internal biological clock that regulates sleep-wake cycles. Exposure to cold temperatures, particularly in the evening or before bedtime, can help reset the circadian rhythm and promote a more natural sleep-wake cycle. Additionally, cold exposure therapy has been found to stimulate the production of melatonin, a hormone that plays a crucial role in regulating sleep. Melatonin is responsible for signaling to the body that it is time to sleep. By increasing melatonin levels, cold exposure may help individuals fall asleep faster and experience more restful sleep. Cold exposure techniques for insomnia. There are several cold exposure techniques that can be incorporated into a bedtime routine to potentially improve insomnia symptoms. Cold showers or baths. Taking a cold shower or bath before bedtime can help lower the body's core temperature, which is essential for initiating sleep. The sudden drop in temperature signals to the body that it is time to rest, promoting relaxation and drowsiness. Cooling the bedroom environment. Creating a cool sleeping environment can also aid in improving sleep quality. Lowering the room temperature or using a fan to circulate cool air can mimic the effects of cold exposure therapy and promote better sleep. Cold compress or ice pack. Applying a cold compress or ice pack to specific areas of the body, such as the forehead or neck, can help induce a state of relaxation and calmness. This technique can be particularly beneficial for individuals who experience insomnia due to stress or anxiety. Cooling mattress or pillow. Investing in a cooling mattress or pillow can provide a consistent cool temperature throughout the night, enhancing comfort and promoting better sleep. These products are designed to regulate body temperature and prevent overheating, which can disrupt sleep. Precautions and considerations. While cold exposure therapy may offer potential benefits for individuals with insomnia, it is important to approach it with caution and consider individual preferences and sensitivities. Some individuals may find cold exposure uncomfortable or may experience adverse effects, such as increased alertness or difficulty falling asleep. It is recommended to start with mild cold exposure techniques and gradually increase the intensity or duration as tolerated. It is also advisable to consult with a healthcare professional, especially if you have any underlying health conditions or concerns. Furthermore, it is essential to maintain a consistent sleep routine and practice good sleep hygiene habits alongside cold exposure therapy. This includes establishing a regular sleep schedule, creating a relaxing bedtime routine, and ensuring a comfortable sleep environment. Conclusion. Cold exposure therapy shows promise as a complementary approach to improve sleep quality and alleviate insomnia symptoms. By influencing the body's circadian rhythm and promoting the release of sleep-regulating hormones, cold exposure may help individuals fall asleep faster, stay asleep longer, and experience more restful sleep. However, it is important to approach cold exposure therapy for insomnia with caution and consider individual preferences and sensitivities. Gradual progression, starting with mild techniques, and consulting with a healthcare professional are recommended. Additionally, maintaining a consistent sleep routine and practicing good sleep hygiene habits are crucial for optimizing the benefits of cold exposure therapy for insomnia. 7.3 Cold exposure and circadian rhythm. The circadian rhythm is an internal biological clock that regulates various physiological processes in our bodies, including sleep-wake cycles, hormone production, body temperature, and metabolism. It is influenced by external cues, such as light and temperature, and plays a crucial role in maintaining our overall health and well-being. Cold exposure therapy has been found to have a significant impact on the circadian rhythm, helping to regulate and optimize its functioning. Understanding the circadian rhythm. The circadian rhythm is primarily regulated by a region in the brain called the suprachiasmatic nucleus, SCN, which receives input from the eye's light-sensitive cells. Light exposure, particularly in the morning, helps synchronize the circadian rhythm and promotes wakefulness and alertness. In contrast, darkness signals the body to produce melatonin, a hormone that promotes sleep. However, the circadian rhythm is not solely influenced by light. Temperature fluctuations also play a crucial role in regulating its functioning. Our body temperature naturally follows a circadian pattern, with a peak during the day and a decline at night. This temperature fluctuation helps regulate our sleep-wake cycles and other physiological processes. Cold exposure and circadian rhythm regulation. Cold exposure therapy, such as cold showers or baths, can have a profound impact on the circadian rhythm. When exposed to cold temperatures, our bodies initiate a thermoregulatory response, causing blood vessels to constrict and redirecting blood flow to vital organs. This response triggers the release of stress hormones, such as adrenaline and cortisol, which help increase alertness and energy levels. The exposure to cold temperatures also stimulates the production of norepinephrine, a neurotransmitter that plays a role in regulating the sleep-wake cycle. Norepinephrine helps promote wakefulness and alertness during the day, while its levels naturally decline in the evening, signaling the body to prepare for sleep. By incorporating cold exposure into our daily routine, particularly in the morning, we can help synchronize our circadian rhythm and promote a healthy sleep-wake cycle. Cold showers or baths in the morning can provide a natural wake-up call, increasing alertness and energy levels for the day ahead. This exposure to cold temperatures helps suppress melatonin production, keeping us awake and alert during the day. Cold exposure and sleep quality. One of the key benefits of regulating the circadian rhythm through cold exposure is improved sleep quality. By synchronizing our internal clock with external cues, such as light and temperature, we can enhance our ability to fall asleep faster, stay asleep throughout the night, and wake up feeling refreshed. Cold exposure therapy helps reset the circadian rhythm by promoting wakefulness during the day and facilitating the natural decline in body temperature in the evening. This temperature drop signals the body to produce melatonin, promoting a deeper and more restful sleep. Additionally, the release of stress hormones during cold exposure can help reduce anxiety and promote relaxation, further enhancing sleep quality. Cold exposure and insomnia. Insomnia is a common sleep disorder characterized by difficulty falling asleep, staying asleep, or experiencing non-restorative sleep. Cold exposure therapy can be a valuable tool in managing insomnia and improving sleep quality. By incorporating cold showers or baths into a bedtime routine, individuals with insomnia can benefit from the temperature-induced drop in body temperature. This drop mimics the natural decline in body temperature that occurs during the evening, signaling the body to prepare for sleep. Cold exposure can also help reduce anxiety and stress, which are often underlying factors contributing to insomnia. Cold exposure and sleep disorders. In addition to insomnia, cold exposure therapy may have potential benefits for individuals with other sleep disorders, such as sleep apnea and restless leg syndrome. Sleep apnea is a condition characterized by interrupted breathing during sleep, leading to poor sleep quality and daytime fatigue. Cold exposure can help improve sleep apnea symptoms by promoting better sleep quality and reducing inflammation in the airways. Restless leg syndrome is a neurological disorder characterized by an irresistible urge to move the legs, often accompanied by uncomfortable sensations. Cold exposure therapy can help alleviate restless leg syndrome symptoms by reducing inflammation and promoting relaxation, leading to improved sleep quality. Conclusion. Cold exposure therapy has a significant impact on the circadian rhythm, helping to regulate and optimize its functioning. By incorporating cold showers or baths into our daily routine, particularly in the morning and evening, we can synchronize our internal clock with external cues and promote a healthy sleep-wake cycle. Cold exposure can improve sleep quality, manage insomnia, and potentially benefit individuals with sleep disorders such as sleep apnea and restless leg syndrome. By understanding the relationship between cold exposure and the circadian rhythm, we can harness the power of temperature to enhance our sleep and overall well-being. 7.4 Cold exposure and sleep disorders. Sleep disorders are a common problem affecting millions of people worldwide. From insomnia to sleep apnea, these conditions can have a significant impact on an individual's overall well-being and quality of life. While there are various treatment options available, cold exposure therapy has emerged as a potential natural remedy for sleep disorders. The link between cold exposure and sleep. Research has shown that there is a strong connection between body temperature and sleep. Our body temperature naturally drops as we prepare for sleep, and it reaches its lowest point during the night. This drop in temperature is essential for initiating and maintaining sleep. Cold exposure therapy takes advantage of this relationship by intentionally exposing the body to cold temperatures, which can help regulate and improve sleep patterns. Cold exposure and insomnia. Insomnia is a sleep disorder characterized by difficulty falling asleep, staying asleep, or experiencing non-restorative sleep. It can have a significant impact on an individual's daily functioning and overall quality of life. Cold exposure therapy has shown promise in alleviating insomnia symptoms and improving sleep quality. When we expose our bodies to cold temperatures, it triggers a physiological response known as vasoconstriction. This process involves the narrowing of blood vessels, which helps redirect blood flow to vital organs and conserve heat. As a result, the body's core temperature decreases, promoting a state of relaxation and calmness that can facilitate sleep onset. Additionally, cold exposure therapy can help regulate the body's circadian rhythm, which is the internal clock that regulates sleep-wake cycles. By exposing oneself to cold temperatures at specific times, such as in the evening or before bedtime, individuals can help synchronize their circadian rhythm and promote a more regular sleep schedule. Cold exposure and sleep apnea. Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breaths during sleep. These interruptions can lead to fragmented sleep and excessive daytime sleepiness. While cold exposure therapy may not directly treat sleep apnea, it can potentially improve sleep quality and reduce the severity of symptoms. One of the underlying causes of sleep apnea is inflammation and swelling of the airways. Cold exposure therapy has anti-inflammatory properties, which can help reduce airway inflammation and improve airflow during sleep. Additionally, the vasoconstriction caused by cold exposure can help decrease fluid retention in the body, including in the neck area, which can contribute to airway obstruction. Cold exposure and restless leg syndrome. Restless leg syndrome (RLS) is a neurological disorder characterized by an irresistible urge to move the legs, often accompanied by uncomfortable sensations. These symptoms typically worsen during periods of rest or inactivity, making it challenging to fall asleep or stay asleep. Cold exposure therapy may offer relief for individuals with RLS by providing a natural way to alleviate symptoms and promote better sleep. Cold exposure can help reduce the sensations of discomfort and restlessness associated with RLS. By applying cold packs or immersing the legs in cold water before bedtime, individuals may experience a temporary numbing effect that can help alleviate the urge to move the legs. This can lead to improved sleep quality and reduced sleep disturbances caused by RLS symptoms. Cold exposure and narcolepsy. Narcolepsy is a neurological disorder characterized by excessive daytime sleepiness, sudden loss of muscle tone, cataplexy, and disrupted sleep patterns. While cold exposure therapy cannot cure narcolepsy, it can potentially improve symptoms and enhance overall sleep quality. Cold exposure therapy stimulates the body's sympathetic nervous system, which is responsible for the body's fight or flight response. This activation can help increase alertness and reduce excessive daytime sleepiness in individuals with narcolepsy. Additionally, the vasoconstriction caused by cold exposure can help regulate blood flow and promote a more stable sleep-wake cycle. Precautions and considerations. While cold exposure therapy shows promise in improving sleep disorders, it is essential to approach it with caution and consult with a healthcare professional, especially if you have any underlying health conditions. Cold exposure therapy may not be suitable for everyone, and individual responses to cold temperatures can vary. It is important to start gradually and slowly increase exposure time and intensity to allow the body to adapt. Additionally, individuals with certain medical conditions, such as Raynaud's disease or cardiovascular problems, should exercise caution when engaging in cold exposure therapy. In conclusion, cold exposure therapy has the potential to improve sleep disorders by leveraging the relationship between body temperature and sleep. From alleviating insomnia symptoms to reducing the severity of sleep apnea, cold exposure therapy offers a natural and non-invasive approach to enhancing sleep quality. However, it is crucial to approach cold exposure therapy with caution and seek guidance from a healthcare professional to ensure its suitability and safety for individual circumstances. 8. Cold exposure and health conditions. 8.1 Cold exposure and cardiovascular health. Cold exposure therapy, also known as cryotherapy, has gained popularity in recent years for its potential health benefits. While many people associate cold exposure with improving physical performance and weight loss, its impact on cardiovascular health is often overlooked. In this section, we will explore the relationship between cold exposure and cardiovascular health, examining the potential benefits and considerations for incorporating cold exposure into your routine. The cardiovascular system and cold exposure. The cardiovascular system plays a vital role in maintaining overall health and well-being. It consists of the heart, blood vessels, and blood, working together to deliver oxygen and nutrients to the body's tissues and organs. Cold exposure can have both immediate and long-term effects on the cardiovascular system. Immediate effects of cold exposure on the cardiovascular system. When exposed to cold temperatures, the body initiates a series of physiological responses to maintain its core temperature. One of the primary responses is vasoconstriction, the narrowing of blood vessels, which helps to conserve heat and redirect blood flow to vital organs. This vasoconstriction can lead to an increase in blood pressure as the heart works harder to pump blood through the narrowed vessels. Additionally, cold exposure triggers the release of stress hormones, such as adrenaline and noradrenaline, which can further elevate blood pressure and heart rate. These immediate effects are similar to the body's response during exercise, making cold exposure a potential cardiovascular workout. Long-term effects of cold exposure on the cardiovascular system. Regular cold exposure has been associated with several long-term benefits for cardiovascular health. One of the key benefits is improved circulation. Cold exposure stimulates the production of nitric oxide, a molecule that helps dilate blood vessels, improving blood flow and reducing the risk of cardiovascular diseases such as hypertension and atherosclerosis. Cold exposure has also been shown to improve the function of the endothelium, the inner lining of blood vessels. A healthy endothelium is crucial for maintaining proper blood flow and preventing the formation of blood clots. By enhancing endothelial function, cold exposure may reduce the risk of cardiovascular events such as heart attacks and strokes. Furthermore, cold exposure has been found to have a positive impact on lipid profiles. Studies have shown that regular cold exposure can increase levels of high-density lipoprotein (HDL) cholesterol, often referred to as good cholesterol, while decreasing levels of low-density lipoprotein (LDL) cholesterol, known as bad cholesterol. This shift in lipid profiles can help reduce the risk of developing cardiovascular diseases. Considerations for cold exposure and cardiovascular health. While cold exposure can offer potential benefits for cardiovascular health, it is essential to consider individual factors and consult with a healthcare professional before incorporating it into your routine, especially if you have pre-existing cardiovascular conditions. Individuals with hypertension or other cardiovascular conditions should approach cold exposure with caution. The sudden increase in blood pressure and heart rate during cold exposure may pose risks for those with underlying cardiovascular issues. It is crucial to start with mild forms of cold exposure, such as cold showers or gradually increasing exposure times, and monitor how your body responds. It is also important to note that cold exposure should not replace traditional medical treatments for cardiovascular conditions. It can be used as a complementary therapy, but it should not be relied upon as the sole method of managing cardiovascular health. Conclusion. Cold exposure therapy has the potential to positively impact cardiovascular health. The immediate effects of vasoconstriction and increased heart rate during cold exposure mimic the body's response to exercise, providing a cardiovascular workout. Long-term benefits include improved circulation, enhanced endothelial function, and favorable changes in lipid profiles. However, it is crucial to approach cold exposure with caution, especially if you have pre-existing cardiovascular conditions. Consult with a healthcare professional before incorporating cold exposure into your routine, and start with mild forms of exposure while monitoring your body's response. Remember that cold exposure should not replace traditional medical treatments for cardiovascular conditions but can be used as a complementary therapy. 8.2 Cold exposure and respiratory health. Cold exposure therapy, also known as cryotherapy, has gained popularity in recent years for its potential health benefits. While most people associate cold exposure with improving physical performance, it also has positive effects on respiratory health. In this section, we will explore how cold exposure can benefit the respiratory system and improve overall lung function. The impact of cold exposure on the respiratory system. When exposed to cold temperatures, the body undergoes several physiological changes to maintain its core temperature. One of these changes is the constriction of blood vessels, known as vasoconstriction, which helps to conserve heat. This vasoconstriction also occurs in the respiratory system, leading to a decrease in blood flow to the airways. While this may seem counterintuitive, the decrease in blood flow actually has a positive effect on respiratory health. It reduces the swelling and inflammation in the airways, making it easier for air to flow in and out of the lungs. This can be particularly beneficial for individuals with respiratory conditions such as asthma or chronic obstructive pulmonary disease, COPD. Cold exposure and asthma. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to symptoms such as wheezing, coughing, and shortness of breath. Cold exposure therapy has shown promising results in improving asthma symptoms and reducing the frequency of asthma attacks. Cold air has a bronchodilatory effect, meaning it helps to relax and widen the airways. This can provide relief for individuals with asthma, as it allows for better airflow and reduces the sensation of breathlessness. Additionally, cold exposure has been found to decrease airway inflammation, further improving respiratory function in individuals with asthma. It is important to note that cold exposure therapy should be done under the guidance of a healthcare professional for individuals with asthma. They can provide personalized recommendations and ensure that the therapy is safe and effective for each individual's specific condition. Cold exposure and chronic obstructive pulmonary disease, COPD. COPD is a progressive lung disease that causes airflow limitation and breathing difficulties. It is often caused by long-term exposure to irritants such as cigarette smoke or air pollution. Cold exposure therapy can be beneficial for individuals with COPD by improving lung function and reducing symptoms. Similar to asthma, cold air has a bronchodilatory effect in individuals with COPD. It helps to relax the airway muscles and improve airflow, making breathing easier. Cold exposure therapy has also been shown to reduce inflammation in the airways, which can help to alleviate symptoms such as coughing and wheezing. As with asthma, individuals with COPD should consult with their healthcare provider before incorporating cold exposure therapy into their treatment plan. They can provide guidance on the appropriate duration and intensity of cold exposure to ensure safety and maximize the benefits. Cold exposure and respiratory infections. Respiratory infections, such as the common cold or flu, are often accompanied by symptoms such as congestion, coughing, and nasal congestion. Cold exposure therapy can help alleviate these symptoms and promote faster recovery. Cold exposure has been found to have an anti-inflammatory effect on the respiratory system, reducing the swelling and congestion in the airways. It can also stimulate the production of immune cells, enhancing the body's ability to fight off infections. Additionally, the vasoconstriction caused by cold exposure can help to reduce nasal congestion and improve breathing. While cold exposure therapy can provide relief for respiratory infections, it is important to note that it should not replace conventional medical treatment. It can be used as a complementary therapy to alleviate symptoms and support the body's natural healing process. Precautions and considerations. While cold exposure therapy can have positive effects on respiratory health, it is essential to take certain precautions to ensure safety and minimize potential risks. Here are some considerations to keep in mind. Gradual progression. Start with shorter exposure times and gradually increase the duration and intensity of cold exposure. This allows the body to adapt and reduces the risk of adverse reactions. Temperature control. Ensure that the cold exposure is within a safe temperature range. Extreme cold temperatures can be harmful to the respiratory system and overall health. Individual differences. Each person may respond differently to cold exposure therapy. It is important to listen to your body and adjust the therapy according to your comfort level. Medical guidance. If you have any pre-existing respiratory conditions or concerns, consult with your healthcare provider before starting cold exposure therapy. They can provide personalized recommendations and ensure that the therapy is safe and appropriate for your specific situation. Incorporating cold exposure therapy into your routine can have significant benefits for respiratory health. However, it is important to approach it with caution and seek professional guidance when needed. By doing so, you can optimize the respiratory benefits of cold exposure and improve your overall well-being. 8.3 Cold exposure and autoimmune diseases. Autoimmune diseases are a group of disorders in which the immune system mistakenly attacks healthy cells and tissues in the body. These conditions can cause a wide range of symptoms and can affect various organs and systems, including the skin, joints, muscles, and organs. While the exact causes of autoimmune diseases are still not fully understood, it is believed that a combination of genetic and environmental factors play a role in their development. Cold exposure therapy, with its ability to modulate the immune system and reduce inflammation, has shown promise in managing autoimmune diseases. By subjecting the body to controlled cold stress, this therapy can potentially help regulate the immune response and alleviate symptoms associated with these conditions. The role of cold exposure in autoimmune diseases. Cold exposure therapy has been found to have several beneficial effects on the immune system, which can be particularly relevant in the context of autoimmune diseases. One of the key mechanisms through which cold exposure exerts its effects is by activating the body's natural anti-inflammatory response. In autoimmune diseases, inflammation plays a central role in the progression of the condition and the associated symptoms. Cold exposure has been shown to reduce the production of pro-inflammatory cytokines, which are molecules involved in the inflammatory response. By dampening the inflammatory cascade, cold exposure may help alleviate symptoms such as pain, swelling, and joint stiffness commonly experienced in autoimmune diseases like rheumatoid arthritis and lupus. Furthermore, cold exposure has been found to stimulate the production of anti-inflammatory cytokines, such as interleukin-10, IL-10. These cytokines help regulate the immune response and promote a balanced immune system. By promoting the production of anti-inflammatory molecules, cold exposure may help restore immune system balance and reduce the excessive immune response seen in autoimmune diseases. Cold exposure and rheumatoid arthritis. Rheumatoid arthritis (RA) is a chronic autoimmune disease characterized by inflammation and joint damage. Cold exposure therapy has shown promise in managing the symptoms of RA and improving the quality of life for individuals living with this condition. Cold exposure can help reduce joint inflammation and pain associated with RA. The application of cold packs or cold water immersion can provide temporary relief by numbing the affected joints and reducing swelling. Additionally, cold exposure has been found to decrease the production of inflammatory markers in individuals with RA, suggesting a potential anti-inflammatory effect. Moreover, cold exposure therapy may also have a positive impact on the structural damage caused by RA. Studies have shown that cold exposure can slow down the progression of joint destruction and preserve joint function. This may be attributed to the ability of cold exposure to reduce inflammation and promote tissue repair processes. Cold exposure and multiple sclerosis. Multiple sclerosis (MS) is a chronic autoimmune disease that affects the central nervous system. It is characterized by inflammation, demyelination, damage to the protective covering of nerve fibers, and neurological symptoms. While there is no cure for MS, cold exposure therapy may offer some benefits in managing the symptoms and slowing down the progression of the disease. Cold exposure has been found to have a neuroprotective effect in MS. It can help reduce inflammation in the central nervous system, which is a key driver of disease progression. By modulating the immune response and reducing inflammation, cold exposure may help protect the myelin sheath and prevent further damage to nerve fibers. Furthermore, cold exposure therapy may also improve fatigue and cognitive function in individuals with MS. Fatigue is a common symptom experienced by individuals with MS and can significantly impact their quality of life. Cold exposure has been shown to reduce fatigue levels and improve cognitive performance, potentially enhancing the overall well-being of individuals with MS. Cold exposure and other autoimmune diseases. While research on the specific effects of cold exposure therapy on other autoimmune diseases is still limited, there is growing interest in exploring its potential benefits. Conditions such as systemic lupus erythematosus (SLE), psoriasis, and inflammatory bowel disease (IBD) are characterized by chronic inflammation and immune dysregulation, making them potential targets for cold exposure therapy. Preliminary studies have shown promising results in individuals with SLE, indicating that cold exposure may help reduce disease activity and improve symptoms. In psoriasis, cold exposure has been found to alleviate skin inflammation and reduce the severity of symptoms. Similarly, in IBD, cold exposure therapy may help modulate the immune response and reduce gut inflammation. While more research is needed to fully understand the mechanisms and optimal protocols for cold exposure therapy in autoimmune diseases, the existing evidence suggests that it may have a role in managing symptoms and improving the quality of life for individuals living with these conditions. It is important to note that cold exposure therapy should be approached with caution and under the guidance of a healthcare professional, especially for individuals with autoimmune diseases. Each person's condition is unique, and the therapy should be tailored to their specific needs and limitations. 8.4 Cold exposure and chronic pain management. Chronic pain is a debilitating condition that affects millions of people worldwide. It can significantly impact a person's quality of life, making even simple daily tasks challenging and exhausting. While there are various treatment options available for chronic pain management, cold exposure therapy has emerged as a promising and natural approach to alleviate pain symptoms. Cold exposure therapy involves exposing the body to cold temperatures for a specific duration. This therapy has been used for centuries to treat various ailments, including pain. The application of cold to the affected area can help reduce inflammation, numb nerve endings, and provide temporary relief from pain. One of the primary ways cold exposure therapy helps manage chronic pain is by reducing inflammation. Inflammation is a common underlying cause of many chronic pain conditions, such as arthritis, fibromyalgia, and back pain. When the body is exposed to cold temperatures, blood vessels constrict, reducing blood flow to the affected area. This constriction helps decrease inflammation and swelling, providing relief from pain. Additionally, cold exposure therapy can help numb nerve endings, which can be beneficial for individuals experiencing neuropathic pain. Neuropathic pain occurs when nerves become damaged or dysfunctional, leading to chronic pain signals being sent to the brain. Cold exposure can help desensitize these nerve endings, reducing the intensity of pain signals and providing temporary relief. Cold exposure therapy can be applied in various ways to manage chronic pain. One common method is the use of ice packs or cold compresses applied directly to the affected area. The cold temperature helps numb the area and reduce inflammation. Another method is cold showers or baths, where the whole body is exposed to cold water. This method can provide overall pain relief and promote relaxation. Cryotherapy, a more advanced form of cold exposure therapy, involves exposing the body to extremely cold temperatures for a short duration. Cryotherapy chambers or localized cryotherapy devices are used to deliver controlled cold temperatures to specific areas of the body. This method can be particularly effective for managing pain in specific joints or muscles. It is important to note that cold exposure therapy should be used as a complementary approach to chronic pain management and not as a standalone treatment. It is always recommended to consult with a healthcare professional before incorporating cold exposure therapy into your pain management routine, especially if you have any underlying health conditions or concerns. While cold exposure therapy can provide temporary relief from chronic pain, it is essential to address the root cause of the pain for long-term management. Physical therapy, exercise, medication, and other treatments may be necessary to manage chronic pain effectively. Cold exposure therapy can be used in conjunction with these treatments to enhance their effectiveness and provide additional relief. In conclusion, cold exposure therapy has shown promise in managing chronic pain by reducing inflammation, numbing nerve endings, and providing temporary relief. It can be used as a complementary approach to other pain management strategies and may help individuals find relief from their symptoms. However, it is crucial to consult with a healthcare professional before incorporating cold exposure therapy into your pain management routine to ensure its safety and effectiveness for your specific condition. 9. Cold exposure and mental health. 9.1 Cold exposure and depression. Depression is a prevalent mental health condition that affects millions of people worldwide. It is characterized by persistent feelings of sadness, hopelessness, and a loss of interest in activities. While there are various treatment options available for depression, including therapy and medication, recent research has shown that cold exposure therapy may also have a positive impact on managing depressive symptoms. Cold exposure therapy involves exposing the body to cold temperatures, either through cold showers, ice baths, or outdoor activities in cold environments. This therapy has gained popularity due to its numerous physical and mental health benefits. When it comes to depression, cold exposure therapy can be a valuable complementary approach to traditional treatments. One of the ways cold exposure therapy may help with depression is by stimulating the release of endorphins. Endorphins are neurotransmitters that act as natural painkillers and mood enhancers. Cold exposure triggers the release of endorphins, which can lead to an improvement in mood and a reduction in depressive symptoms. Additionally, the cold temperature can also activate the sympathetic nervous system, which is responsible for the body's fight or flight response. This activation can increase alertness and energy levels, providing a temporary boost to individuals experiencing depression. Furthermore, cold exposure therapy has been found to have an impact on the levels of certain neurotransmitters in the brain, such as serotonin and norepinephrine. These neurotransmitters play a crucial role in regulating mood and emotions. Research suggests that cold exposure may increase the production and release of these neurotransmitters, which can help alleviate symptoms of depression. Serotonin, in particular, is often targeted by antidepressant medications, and increasing its levels naturally through cold exposure therapy may provide similar benefits. In addition to the physiological effects, cold exposure therapy can also have a positive impact on mental health by promoting resilience and stress reduction. Depression often leads to a heightened sensitivity to stress, making it difficult for individuals to cope with daily challenges. Cold exposure therapy can help individuals build mental resilience by exposing them to controlled stressors. By gradually exposing themselves to cold temperatures, individuals can learn to tolerate discomfort and develop a sense of control over their body's response to stress. This increased resilience can translate into better coping mechanisms for managing depressive symptoms. Moreover, cold exposure therapy can also improve sleep quality, which is often disrupted in individuals with depression. Cold exposure has been shown to regulate the sleep-wake cycle and promote deeper, more restful sleep. By improving sleep quality, individuals may experience a reduction in depressive symptoms, as sleep disturbances are closely linked to mood disorders. It is important to note that cold exposure therapy should be approached with caution and under the guidance of a healthcare professional, especially for individuals with severe depression or other underlying health conditions. While cold exposure therapy can be beneficial, it is not a standalone treatment for depression and should be used in conjunction with other evidence-based therapies. Incorporating cold exposure therapy into a daily routine can be done in various ways. Starting with cold showers for a few minutes each day and gradually increasing the exposure time can be a good starting point. Ice baths or cryotherapy sessions under the supervision of a trained professional are also options to consider. Outdoor activities in cold environments, such as winter sports or cold water swimming, can provide both physical and mental health benefits. In conclusion, cold exposure therapy has the potential to be a valuable adjunctive treatment for depression. By stimulating the release of endorphins, regulating neurotransmitter levels, promoting resilience, and improving sleep quality, cold exposure therapy can help individuals manage depressive symptoms. However, it is essential to consult with a healthcare professional before incorporating cold exposure therapy into a treatment plan for depression. 9.2 Cold exposure and anxiety. Anxiety is a common mental health condition that affects millions of people worldwide. It is characterized by excessive worry, fear, and apprehension, often accompanied by physical symptoms such as rapid heartbeat, sweating, and shortness of breath. While there are various treatment options available for anxiety, including therapy and medication, cold exposure therapy has emerged as a promising complementary approach. Cold exposure therapy involves intentionally exposing oneself to cold temperatures for therapeutic purposes. It can be done through various methods, such as cold showers, ice baths, or spending time in cold environments. While the primary focus of cold exposure therapy is on physical benefits, research suggests that it can also have a positive impact on mental health, including anxiety. One of the ways cold exposure therapy may help with anxiety is by activating the body's natural stress response system. When exposed to cold temperatures, the body releases stress hormones like adrenaline and cortisol, which can help regulate the body's response to stress and anxiety. This activation of the stress response system can lead to a reduction in anxiety symptoms and an overall sense of calmness. Furthermore, cold exposure therapy has been found to stimulate the release of endorphins, which are natural mood-boosting chemicals in the brain. Endorphins are known to promote feelings of well-being and can help alleviate symptoms of anxiety. The cold temperature itself can also act as a distraction from anxious thoughts, as the body focuses on the physical sensation of the cold rather than the worries and fears. In addition to the physiological effects, cold exposure therapy can also have a positive impact on anxiety through its ability to improve mental resilience. Regular exposure to cold temperatures can help individuals develop a greater tolerance for discomfort and build mental strength. This increased resilience can translate into better coping mechanisms for managing anxiety-inducing situations in daily life. Cold exposure therapy may also help individuals with anxiety by promoting better sleep. Anxiety often disrupts sleep patterns, leading to difficulties falling asleep or staying asleep throughout the night. Cold exposure has been shown to improve sleep quality by regulating the body's circadian rhythm and promoting relaxation. By improving sleep, cold exposure therapy can indirectly reduce anxiety symptoms and improve overall mental well-being. It is important to note that cold exposure therapy should be approached with caution, especially for individuals with pre-existing medical conditions or those who are particularly sensitive to cold temperatures. It is recommended to consult with a healthcare professional before incorporating cold exposure therapy into an anxiety management plan. When considering cold exposure therapy for anxiety, it is essential to start gradually and build up tolerance over time. Begin with shorter durations of exposure to cold temperatures, such as taking shorter cold showers or spending a few minutes in an ice bath. As tolerance increases, gradually increase the duration and intensity of cold exposure. It is also important to listen to your body and pay attention to any signs of discomfort or excessive stress. If cold exposure therapy exacerbates anxiety symptoms or causes distress, it may not be the right approach for you. Everyone's response to cold exposure therapy is unique, and it is essential to find the method that works best for your individual needs. In conclusion, while more research is needed to fully understand the effects of cold exposure therapy on anxiety, preliminary evidence suggests that it may have potential benefits. Cold exposure therapy can activate the body's stress response system, release mood-boosting endorphins, improve mental resilience, and promote better sleep, all of which can contribute to a reduction in anxiety symptoms. However, it is crucial to approach cold exposure therapy with caution, consult with a healthcare professional, and listen to your body's response. 9.3 Cold exposure and stress disorders. Stress is a common and often unavoidable part of life. It can manifest in various forms, such as work-related stress, relationship issues, financial pressures, or traumatic events. Prolonged or chronic stress can have detrimental effects on both our physical and mental well-being. Fortunately, cold exposure therapy has shown promise in helping individuals manage and reduce stress levels. Stress disorders, such as post-traumatic stress disorder (PTSD), generalized anxiety disorder (GAD), and panic disorder, can significantly impact a person's quality of life. These disorders are characterized by persistent feelings of fear, worry, and unease, often accompanied by physical symptoms like increased heart rate, sweating, and muscle tension. Cold exposure therapy can be a valuable tool in the treatment and management of stress disorders. One of the primary ways cold exposure therapy helps with stress disorders is by activating the body's natural stress response system. When exposed to cold temperatures, the body releases stress hormones like adrenaline and cortisol. These hormones trigger a series of physiological responses, including increased heart rate, improved blood circulation, and heightened alertness. This activation of the stress response system can help individuals with stress disorders regain a sense of control and resilience. Cold exposure therapy also promotes the release of endorphins, which are natural painkillers and mood enhancers. Endorphins help reduce anxiety and improve mood, providing a sense of calm and relaxation. Additionally, cold exposure has been found to increase the production of neurotransmitters like serotonin and dopamine, which play crucial roles in regulating mood and emotions. By boosting these neurotransmitters, cold exposure therapy can alleviate symptoms of stress disorders and promote a more positive mental state. Furthermore, cold exposure therapy can help individuals with stress disorders develop better coping mechanisms. Facing the discomfort and challenges of cold exposure requires mental strength and resilience. By gradually exposing themselves to cold temperatures, individuals can learn to tolerate and manage uncomfortable situations. This process can translate into improved coping skills for dealing with stressors in everyday life. Cold exposure therapy teaches individuals to face their fears, build resilience, and develop a greater sense of control over their stress responses. Another way cold exposure therapy can benefit individuals with stress disorders is by improving sleep quality. Stress often disrupts sleep patterns, leading to insomnia or poor sleep quality. Cold exposure has been shown to promote better sleep by regulating the body's circadian rhythm, the internal clock that controls sleep-wake cycles. Exposure to cold temperatures in the evening can help synchronize the circadian rhythm, leading to more restful and rejuvenating sleep. By improving sleep quality, cold exposure therapy indirectly reduces stress levels and enhances overall well-being. It is important to note that cold exposure therapy should be approached with caution for individuals with severe stress disorders or trauma-related conditions. It is recommended to consult with a healthcare professional or therapist before incorporating cold exposure therapy into a treatment plan. They can provide guidance on the appropriate duration, intensity, and frequency of cold exposure sessions based on individual needs and circumstances. In conclusion, cold exposure therapy offers a promising approach for managing stress disorders. By activating the body's stress response system, promoting the release of endorphins, and improving sleep quality, cold exposure therapy can help individuals reduce stress levels and develop better coping mechanisms. However, it is essential to seek professional guidance when incorporating cold exposure therapy into a treatment plan, especially for individuals with severe stress disorders or trauma-related conditions. With proper guidance and a gradual approach, cold exposure therapy can be a valuable tool in the journey towards stress reduction and improved mental well-being. 9.4 Cold exposure and cognitive function. Cold exposure therapy has been shown to have a positive impact on cognitive function. The physiological effects of cold exposure, such as increased blood flow and improved oxygenation to the brain, can enhance cognitive performance and mental clarity. In this section, we will explore the relationship between cold exposure and cognitive function, and how incorporating cold exposure into your routine can benefit your brain health. Cognitive function and cold exposure. Cognitive function refers to the mental processes and abilities that allow us to think, reason, learn, and remember. It encompasses various aspects such as attention, memory, problem-solving, decision-making, and creativity. Maintaining optimal cognitive function is crucial for overall well-being and quality of life. Research has shown that cold exposure can have a positive impact on cognitive function. Cold temperatures stimulate the release of norepinephrine, a neurotransmitter that plays a key role in attention and focus. This increase in norepinephrine levels can enhance cognitive performance, including improved attention span, concentration, and mental alertness. Furthermore, cold exposure has been found to increase the production of brain-derived neurotrophic factor, BDNF, a protein that promotes the growth and survival of neurons. BDNF is essential for neuroplasticity, which is the brain's ability to adapt and reorganize itself in response to new experiences and learning. By promoting neuroplasticity, cold exposure can enhance cognitive function and improve learning and memory. Cold exposure and mental clarity. One of the benefits of cold exposure therapy is its ability to improve mental clarity. When exposed to cold temperatures, the body activates its natural stress response, releasing hormones such as adrenaline and cortisol. These hormones increase alertness and focus, helping to clear the mind and improve cognitive performance. Cold exposure also stimulates the production of endorphins, which are natural painkillers and mood enhancers. Endorphins can improve mood, reduce stress, and increase mental clarity. By reducing stress and promoting a positive mood, cold exposure can enhance cognitive function and mental performance. Cold exposure and brain health. In addition to its immediate effects on cognitive function, cold exposure therapy may also have long-term benefits for brain health. Research suggests that cold exposure can help protect against age-related cognitive decline and neurodegenerative diseases such as Alzheimer's and Parkinson's. Cold exposure activates heat shock proteins, which are responsible for repairing damaged proteins and preventing protein aggregation in the brain. Protein aggregation is a hallmark of neurodegenerative diseases, and by promoting the clearance of damaged proteins, cold exposure may help prevent the development of these conditions. Furthermore, cold exposure has been found to increase the production of antioxidants in the body, which help protect against oxidative stress and inflammation. Oxidative stress and inflammation are implicated in the development of neurodegenerative diseases, and by reducing these processes, cold exposure may help preserve brain health and cognitive function. Incorporating cold exposure into your routine. If you're interested in harnessing the cognitive benefits of cold exposure, there are several methods you can incorporate into your routine. Cold showers. Start by gradually reducing the temperature of your showers, ending with a cold blast for a few minutes. This can help wake up your mind and improve mental clarity. Ice baths or cryotherapy. These methods involve immersing your body in cold water or using specialized cryotherapy chambers. Start with shorter durations and gradually increase the time as your body adapts. Outdoor cold exposure. Spending time outdoors in cold weather can provide a natural form of cold exposure. Dress appropriately and gradually increase the duration of your outdoor activities. Breathing techniques. Certain breathing techniques, such as Wim Hof method, combine controlled breathing exercises with cold exposure. These techniques can help improve focus, reduce stress, and enhance cognitive function. When incorporating cold exposure into your routine, it's important to start gradually and listen to your body. Pay attention to any signs of discomfort or excessive cold exposure, and adjust accordingly. It's also essential to consult with a healthcare professional, especially if you have any underlying health conditions. Conclusion. Cold exposure therapy has the potential to enhance cognitive function and improve brain health. By incorporating cold exposure into your routine, you can experience improved mental clarity, enhanced focus, and potentially protect against age-related cognitive decline. Whether through cold showers, ice baths, outdoor exposure, or breathing techniques, there are various methods to explore and find what works best for you. Remember to start gradually, prioritize safety, and consult with a healthcare professional if needed. Embrace the frozen frontier and unlock the cognitive benefits of cold exposure. 10. Cold exposure and aging. 10.1 Cold exposure and longevity. Cold exposure therapy, also known as cryotherapy, has gained significant attention in recent years for its potential health benefits. While it is primarily used for its physiological and psychological effects, there is emerging evidence suggesting that cold exposure may also have a positive impact on longevity. The science behind cold exposure and longevity. Research has shown that cold exposure activates various physiological mechanisms in the body, including the activation of brown adipose tissue (BAT) and the release of certain hormones. These mechanisms are believed to play a role in the potential longevity benefits of cold exposure. One of the key factors associated with longevity is the preservation of telomeres, which are protective caps at the ends of chromosomes. Telomeres naturally shorten as we age, and this shortening is associated with cellular aging and an increased risk of age-related diseases. Studies have found that cold exposure may help preserve telomere length, potentially slowing down the aging process. Cold exposure also activates a process called autophagy, which is the body's way of cleaning out damaged cells and recycling cellular components. Autophagy has been linked to longevity and is believed to play a role in reducing the risk of age-related diseases. Cold exposure may enhance autophagy, promoting cellular health and longevity. Cold exposure and cellular health. One of the ways cold exposure may promote longevity is by improving cellular health. Cold exposure has been shown to increase the production of heat shock proteins, HSPs, which are responsible for repairing damaged proteins and maintaining cellular function. By increasing the production of HSPs, cold exposure may help protect cells from damage and improve overall cellular health. Additionally, cold exposure has been found to increase the production of antioxidants in the body. Antioxidants help neutralize harmful free radicals, which can cause cellular damage and contribute to aging. By increasing antioxidant production, cold exposure may help reduce oxidative stress and promote longevity. Cold exposure and inflammation. Chronic inflammation is a common feature of many age-related diseases, including cardiovascular disease, diabetes, and neurodegenerative disorders. Cold exposure has been shown to have anti-inflammatory effects, potentially reducing the risk of these diseases and promoting longevity. Cold exposure activates the body's natural anti-inflammatory response, which involves the release of anti-inflammatory cytokines and the suppression of pro-inflammatory cytokines. This balance between pro-inflammatory and anti-inflammatory factors is crucial for maintaining a healthy immune system and reducing the risk of chronic inflammation. Cold exposure and metabolism. Metabolic health is closely linked to longevity, and cold exposure has been found to have positive effects on metabolism. Cold exposure activates brown adipose tissue, BAT, a type of fat that generates heat by burning calories. BAT activation increases energy expenditure and may help with weight management, which is associated with improved metabolic health and longevity. Cold exposure has also been shown to improve insulin sensitivity, which is important for maintaining healthy blood sugar levels. Insulin resistance is a common feature of metabolic disorders such as type 2 diabetes, and improving insulin sensitivity can help reduce the risk of these conditions and promote longevity. Cold exposure and stress resistance. Stress resistance is another key factor associated with longevity. Cold exposure has been found to increase the body's stress resistance by activating the hypothalamic pituitary adrenal (HPA) axis and the release of stress hormones such as cortisol. This activation of the stress response helps the body adapt to and cope with various stressors, promoting resilience and potentially extending lifespan. Furthermore, cold exposure has been shown to improve heart rate variability (HRV), which is a measure of the variability in time intervals between heartbeats. Higher HRV is associated with better stress resilience and overall health. By improving HRV, cold exposure may enhance the body's ability to respond to stress and promote longevity. Conclusion. While more research is needed to fully understand the relationship between cold exposure and longevity, the existing evidence suggests that cold exposure therapy may have potential benefits in this area. By improving cellular health, reducing inflammation, enhancing metabolism, and promoting stress resistance, cold exposure may contribute to a longer and healthier life. Incorporating cold exposure into a well-rounded lifestyle that includes a balanced diet, regular exercise, and other healthy habits may offer a holistic approach to promoting longevity. 10.2 Cold exposure and age-related diseases. As we age, our bodies undergo various changes that can increase the risk of developing age-related diseases. However, emerging research suggests that cold exposure therapy may have a positive impact on mitigating the risk and progression of these diseases. In this section, we will explore the potential benefits of cold exposure therapy in relation to age-related diseases and discuss the underlying mechanisms. Cold exposure and cardiovascular health. Cardiovascular diseases, such as heart disease and stroke, are among the leading causes of death worldwide, particularly in older adults. Cold exposure therapy has shown promising effects in improving cardiovascular health and reducing the risk of these diseases. When exposed to cold temperatures, our blood vessels constrict, leading to increased blood pressure. This response triggers the release of nitric oxide, a molecule that helps relax blood vessels and improve blood flow. By regularly exposing ourselves to cold temperatures, we can enhance the flexibility and function of our blood vessels, reducing the risk of cardiovascular diseases. Furthermore, cold exposure therapy has been found to stimulate the production of brown fat, a type of fat that generates heat by burning calories. Brown fat activation has been associated with improved lipid metabolism and reduced risk factors for cardiovascular diseases, such as high cholesterol and triglyceride levels. Additionally, cold exposure can enhance the production of adiponectin, a hormone that plays a crucial role in regulating insulin sensitivity and reducing inflammation, both of which are important for maintaining cardiovascular health. Cold exposure and neurodegenerative diseases. Neurodegenerative diseases, including Alzheimer's and Parkinson's disease, are characterized by the progressive loss of neurons in the brain. These diseases often result in cognitive decline, memory loss, and impaired motor function. While there is no cure for neurodegenerative diseases, recent studies have suggested that cold exposure therapy may have potential benefits in slowing down their progression. Cold exposure has been found to activate heat shock proteins, which are responsible for protecting cells from stress and promoting their survival. Heat shock proteins play a crucial role in preventing the accumulation of misfolded proteins, a hallmark of neurodegenerative diseases. By activating these proteins, cold exposure therapy may help reduce the buildup of toxic proteins and delay the onset or progression of neurodegenerative diseases. Furthermore, cold exposure has been shown to enhance brain-derived neurotrophic factor (BDNF) levels. BDNF is a protein that promotes the growth and survival of neurons, as well as the formation of new connections between them. Low levels of BDNF have been associated with neurodegenerative diseases, while increased levels have been linked to improved cognitive function and neuroprotection. By increasing BDNF levels, cold exposure therapy may support brain health and potentially reduce the risk of neurodegenerative diseases. Cold exposure and osteoporosis. Osteoporosis is a condition characterized by the loss of bone density, making bones more fragile and prone to fractures. It is a common age-related disease, particularly affecting postmenopausal women. Cold exposure therapy has shown promise in improving bone health and reducing the risk of osteoporosis. Cold exposure stimulates the release of hormones such as growth hormone and insulin-like growth factor 1, IGF-1, which play a crucial role in bone formation and remodeling. These hormones promote the activity of osteoblasts, the cells responsible for building new bone tissue. By enhancing the activity of osteoblasts, cold exposure therapy may help maintain bone density and reduce the risk of fractures. Additionally, cold exposure has been found to reduce inflammation, which is a contributing factor to bone loss in osteoporosis. Chronic inflammation can lead to increased bone resorption, where bone tissue is broken down faster than it is replaced. By reducing inflammation, cold exposure therapy may help preserve bone density and prevent the progression of osteoporosis. Cold exposure and age-related inflammation. Inflammation is a natural response of the immune system to injury or infection. However, chronic inflammation, often referred to as inflammaging, is a hallmark of aging and is associated with various age-related diseases, including cardiovascular diseases, neurodegenerative diseases, and cancer. Cold exposure therapy has been shown to have anti-inflammatory effects, which may help mitigate the risk and progression of these diseases. Cold exposure activates the body's stress response, leading to the release of stress hormones such as cortisol. These hormones have potent anti-inflammatory properties and can help regulate the immune response. By modulating the immune system and reducing chronic inflammation, cold exposure therapy may contribute to overall health and well-being in older adults. Conclusion. Cold exposure therapy holds promise in mitigating the risk and progression of age-related diseases. By improving cardiovascular health, supporting brain function, enhancing bone density, and reducing chronic inflammation, cold exposure therapy may help older adults maintain their health and well-being as they age. However, it is important to note that cold exposure therapy should be approached with caution, particularly for individuals with pre-existing health conditions. Consulting with a healthcare professional is recommended before incorporating cold exposure therapy into your routine. 10.3 Cold exposure and cognitive decline. Cognitive decline is a natural part of the aging process, but research suggests that cold exposure therapy may have potential benefits in slowing down or even preventing cognitive decline. As we age, our cognitive abilities, such as memory, attention, and problem-solving skills, tend to decline. However, emerging evidence indicates that cold exposure therapy can positively impact cognitive function and protect against age-related cognitive decline. The role of cold exposure in cognitive function. Cold exposure therapy involves subjecting the body to cold temperatures, either through cold showers, ice baths, or outdoor cold exposure. When exposed to cold, the body activates various physiological responses to maintain its core temperature. These responses include vasoconstriction, increased heart rate, and shivering. These processes not only help the body adapt to the cold but also have a profound impact on the brain. Cold exposure and brain health. Research suggests that cold exposure therapy can enhance brain health and cognitive function through several mechanisms. One of the key mechanisms is the activation of brown adipose tissue, BAT. BAT is a type of fat that generates heat when activated, helping to regulate body temperature. Cold exposure stimulates the activation of BAT, which in turn releases various beneficial substances called adipokines. These adipokines have been shown to have neuroprotective effects and promote brain health. Furthermore, cold exposure therapy has been found to increase the production of brain-derived neurotrophic factor, BDNF. BDNF is a protein that plays a crucial role in the growth, survival, and maintenance of neurons. It promotes the formation of new connections between brain cells, enhances synaptic plasticity, and supports the survival of existing neurons. By increasing BDNF levels, cold exposure therapy may help to preserve cognitive function and prevent cognitive decline. Cold exposure and neuroinflammation. Neuroinflammation, characterized by chronic inflammation in the brain, is believed to contribute to the development of neurodegenerative diseases and cognitive decline. Cold exposure therapy has been shown to have anti-inflammatory effects, reducing the levels of pro-inflammatory cytokines in the body. By reducing neuroinflammation, cold exposure may help protect against cognitive decline and improve brain health. Cold exposure and blood flow. Another way in which cold exposure therapy may benefit cognitive function is by improving blood flow to the brain. Cold exposure causes vasoconstriction, which temporarily reduces blood flow to the extremities. However, this reduction in peripheral blood flow is compensated by an increase in blood flow to vital organs, including the brain. The increased blood flow to the brain delivers more oxygen and nutrients, supporting optimal brain function and cognitive performance. Cold exposure and cognitive performance. Several studies have investigated the effects of cold exposure therapy on cognitive performance. One study published in the journal, Frontiers in Physiology, found that cold water immersion improved cognitive performance in healthy young adults. Participants who underwent cold water immersion showed enhanced attention, processing speed, and working memory compared to those who underwent a control condition. Another study published in the Journal of Clinical Psychopharmacology examined the effects of cold exposure therapy on cognitive function in individuals with depression. The results showed that cold water immersion significantly improved cognitive performance, including attention, memory, and executive function, in individuals with depression. Cold exposure and neurodegenerative diseases. In addition to its potential benefits in age-related cognitive decline, cold exposure therapy may also have implications for neurodegenerative diseases such as Alzheimer's and Parkinson's disease. These diseases are characterized by the accumulation of abnormal proteins in the brain and the progressive loss of neurons. Research suggests that cold exposure therapy may help to reduce the accumulation of these abnormal proteins and protect against neuronal damage. Cold exposure has been shown to enhance the clearance of amyloid beta, a protein associated with Alzheimer's disease, from the brain. It also activates cellular pathways involved in protein quality control, promoting the removal of damaged proteins and preventing their accumulation. Furthermore, cold exposure therapy has been found to increase the production of heat shock proteins, HSPs. HSPs play a crucial role in protecting cells from stress and preventing protein misfolding. By increasing HSP production, cold exposure may help to protect against neurodegenerative diseases and preserve cognitive function. Conclusion. Cold exposure therapy shows promise in preserving cognitive function and protecting against cognitive decline. By activating brown adipose tissue, reducing neuroinflammation, improving blood flow to the brain, and enhancing cognitive performance, cold exposure may have significant benefits for brain health. Further research is needed to fully understand the mechanisms underlying these effects and to determine the optimal protocols for cold exposure therapy in the context of cognitive decline. However, incorporating cold exposure into a healthy lifestyle may be a valuable strategy for maintaining cognitive function and promoting brain health as we age. 10.4 Cold exposure and skin aging. Cold exposure therapy has gained significant attention for its potential benefits in various aspects of health and well-being. One area that has been of particular interest is its impact on skin aging. As we age, our skin undergoes natural changes, including the loss of elasticity, the formation of wrinkles, and the appearance of age spots. However, research suggests that cold exposure therapy may help slow down these aging processes and promote healthier, more youthful-looking skin. The effects of cold exposure on the skin. Cold exposure therapy involves subjecting the body to cold temperatures, which can have several effects on the skin. When exposed to cold, the blood vessels in the skin constrict, reducing blood flow to the area. This constriction can help reduce inflammation and puffiness, resulting in a more toned and tightened appearance. Additionally, cold exposure can stimulate the production of collagen, a protein that provides structure and elasticity to the skin. Increased collagen production can help improve skin firmness and reduce the appearance of fine lines and wrinkles. Cold exposure and skin rejuvenation. One of the key benefits of cold exposure therapy for skin aging is its potential to promote skin rejuvenation. Cold temperatures can stimulate the production of new skin cells, leading to a more youthful and radiant complexion. This process, known as skin cell turnover, helps shed dead skin cells and replace them with fresh, healthy cells. By promoting skin cell turnover, cold exposure therapy can help improve skin texture, reduce the appearance of blemishes, and enhance overall skin tone. Cold exposure and skin tightening. As mentioned earlier, cold exposure causes the blood vessels in the skin to constrict, resulting in a temporary tightening effect. This tightening effect can help reduce the appearance of sagging skin and improve facial contours. Cold exposure therapy can be particularly beneficial for areas prone to sagging, such as the jawline, neck, and under eye area. By promoting skin tightening, cold exposure therapy can help create a more youthful and lifted appearance. Cold exposure and skin hydration. Another important aspect of skin aging is hydration. As we age, our skin tends to become drier, which can exacerbate the appearance of wrinkles and fine lines. Cold exposure therapy can help improve skin hydration by increasing the production of natural moisturizing factors in the skin. These factors help retain moisture and prevent water loss, resulting in a more hydrated and plump complexion. Additionally, cold exposure can help improve the absorption of skincare products, allowing them to penetrate deeper into the skin and provide optimal hydration. Cold exposure and skin protection. In addition to its rejuvenating and hydrating effects, cold exposure therapy may also offer protection against environmental damage. Cold temperatures can help reduce the production of harmful free radicals in the skin, which are known to contribute to premature aging. By minimizing free radical damage, cold exposure therapy can help protect the skin from oxidative stress and maintain its youthful appearance. Furthermore, cold exposure can help strengthen the skin's barrier function, making it more resilient to external aggressors such as pollution and UV radiation. Incorporating cold exposure into skincare routine. To incorporate cold exposure therapy into your skincare routine, there are several methods you can try. Cold water rinses or splashes on the face can provide a quick and refreshing way to stimulate the skin. You can also consider using ice cubes wrapped in a cloth and gently massaging them onto the skin. Another option is to explore cryotherapy facials or treatments, which involve exposing the skin to extremely cold temperatures for a short period. These treatments are typically performed by professionals and can offer more targeted and intense cold exposure. It's important to note that while cold exposure therapy can have numerous benefits for the skin, it's essential to practice it safely and gradually. Start with shorter exposure times and gradually increase the duration as your body adapts. Additionally, always protect your skin from extreme cold temperatures by wearing appropriate clothing and using moisturizers to prevent excessive dryness. In conclusion, cold exposure therapy has the potential to positively impact skin aging. By promoting skin rejuvenation, tightening, hydration, and protection, cold exposure can help maintain a more youthful and vibrant complexion. Incorporating cold exposure into your skincare routine, along with other healthy habits like a balanced diet and sun protection, can contribute to healthier and more resilient skin as you age. 11. Cold exposure and environmental sustainability. 11.1 Reducing energy consumption with cold exposure. Cold exposure therapy not only offers numerous health benefits but also has the potential to contribute to environmental sustainability by reducing energy consumption. As we strive to find ways to mitigate climate change and reduce our carbon footprint, incorporating cold exposure practices into our daily lives can play a significant role in achieving these goals. One of the primary ways in which cold exposure therapy can help reduce energy consumption is by decreasing the reliance on artificial heating and cooling systems. By exposing ourselves to colder temperatures, we can gradually acclimate our bodies to lower ambient temperatures, allowing us to tolerate cooler indoor environments without the need for excessive heating. This can lead to a significant reduction in energy consumption and lower greenhouse gas emissions associated with heating our homes and buildings. During the winter months, many people tend to keep their indoor spaces excessively warm, often relying on central heating systems to maintain a comfortable temperature. However, by regularly exposing ourselves to cold temperatures through practices such as cold showers or spending time outdoors in colder weather, we can increase our tolerance to lower temperatures. This can enable us to lower the thermostat in our homes, reducing the need for constant heating and ultimately saving energy. Similarly, in warmer climates, cold exposure therapy can help reduce the reliance on air conditioning systems. By gradually exposing ourselves to colder temperatures, our bodies can adapt and become more efficient at regulating body temperature. This adaptation can lead to increased comfort in warmer environments, allowing us to set our air conditioning units at higher temperatures or even forego their use altogether. By reducing the demand for air conditioning, we can significantly decrease energy consumption and the associated environmental impact. In addition to reducing energy consumption in our homes and buildings, cold exposure therapy can also contribute to sustainable cooling solutions. Traditional cooling methods, such as refrigeration and air conditioning, often rely on the use of harmful refrigerants that contribute to ozone depletion and global warming. By incorporating cold exposure practices into our daily routines, we can reduce our reliance on these energy-intensive cooling systems, thereby minimizing the need for harmful refrigerants. Furthermore, cold exposure therapy can also have a positive impact on sustainable agriculture. Many crops require specific temperature ranges for optimal growth, and farmers often rely on energy-intensive methods such as heating or cooling systems to maintain these conditions. By exposing crops to controlled cold temperatures, farmers can potentially reduce the need for artificial heating or cooling, leading to energy savings and a more sustainable approach to agriculture. It is important to note that while cold exposure therapy can contribute to reducing energy consumption, it should be done in a safe and controlled manner. Gradual progression and adherence to safety guidelines are crucial to avoid any adverse effects on health or well-being. It is recommended to consult with a healthcare professional or cold exposure specialist to ensure that the practices are suitable for individual circumstances. In conclusion, cold exposure therapy not only offers a wide range of health benefits but also has the potential to contribute to environmental sustainability by reducing energy consumption. By gradually acclimating our bodies to colder temperatures, we can decrease our reliance on artificial heating and cooling systems, leading to significant energy savings and a reduced carbon footprint. Incorporating cold exposure practices into our daily routines can play a vital role in mitigating climate change and promoting a more sustainable future. 11.2 Cold exposure and sustainable cooling solutions. As the world continues to grapple with the effects of climate change, finding sustainable solutions for cooling becomes increasingly important. Traditional cooling methods, such as air conditioning, contribute to greenhouse gas emissions and exacerbate global warming. However, cold exposure therapy offers a unique opportunity to explore sustainable cooling solutions that are not only beneficial for individuals but also for the environment. Cold exposure therapy involves exposing the body to cold temperatures for therapeutic purposes. While the primary focus of this therapy is on the physiological and psychological benefits for individuals, it also has the potential to contribute to sustainable cooling practices on a larger scale. By harnessing the principles of cold exposure therapy, innovative cooling solutions can be developed that are energy efficient, environmentally friendly, and economically viable. One of the key aspects of sustainable cooling solutions is reducing energy consumption. Traditional cooling methods, such as air conditioning, consume a significant amount of energy, leading to increased carbon emissions. Cold exposure therapy, on the other hand, promotes the use of natural cooling methods that require minimal energy input. By incorporating these principles into cooling systems, energy consumption can be significantly reduced, resulting in lower greenhouse gas emissions and a more sustainable approach to cooling. One example of a sustainable cooling solution inspired by cold exposure therapy is the use of natural ventilation systems. These systems utilize the principles of airflow and natural convection to cool indoor spaces. By strategically designing buildings to maximize natural ventilation, the need for mechanical cooling systems can be minimized or even eliminated. This not only reduces energy consumption but also improves indoor air quality and reduces reliance on fossil fuels. Another innovative approach to sustainable cooling is the use of radiant cooling systems. These systems work by circulating cool water through pipes embedded in ceilings, walls, or floors, effectively cooling the surrounding space. Radiant cooling provides a comfortable and energy-efficient alternative to traditional air conditioning. By integrating radiant cooling systems into buildings, energy consumption can be significantly reduced, leading to lower carbon emissions and a more sustainable cooling solution. Cold exposure therapy also emphasizes the importance of insulation. Insulation plays a crucial role in maintaining a comfortable indoor temperature by preventing heat transfer between the interior and exterior of a building. By improving insulation standards in buildings, energy consumption for cooling can be reduced, resulting in lower carbon emissions. Additionally, proper insulation helps to create a more sustainable and energy-efficient living environment. Incorporating renewable energy sources into cooling systems is another way to make them more sustainable. Cold exposure therapy can inspire the use of renewable energy technologies, such as solar-powered cooling systems. By harnessing the power of the sun, these systems can provide cooling without relying on fossil fuels. Solar-powered cooling not only reduces carbon emissions but also helps to mitigate the environmental impact of traditional cooling methods. Furthermore, cold exposure therapy can contribute to sustainable agriculture practices. Cold storage is an essential component of the agricultural supply chain, ensuring the preservation of perishable goods. By implementing energy-efficient cold storage solutions inspired by cold exposure therapy, the agricultural industry can reduce energy consumption and minimize food waste. This not only benefits the environment but also improves the economic viability of the agricultural sector. In conclusion, cold exposure therapy offers more than just individual health benefits. It provides a foundation for exploring sustainable cooling solutions that are energy efficient, environmentally friendly, and economically viable. By incorporating the principles of cold exposure therapy into cooling systems, we can reduce energy consumption, lower carbon emissions, and mitigate the impact of climate change. From natural ventilation and radiant cooling systems to renewable energy integration and sustainable agriculture practices, cold exposure therapy inspires innovative solutions that promote a more sustainable and cooler future. 11.3 Cold exposure and climate change mitigation. As the world grapples with the urgent need to address climate change, innovative solutions are being explored in various sectors. One such solution that has gained attention is the potential role of cold exposure therapy in climate change mitigation. While cold exposure therapy primarily focuses on the health benefits for individuals, it also has the potential to contribute to broader environmental sustainability efforts. In this section, we will explore the connection between cold exposure therapy and climate change mitigation. The energy efficiency of cold exposure therapy. Cold exposure therapy often involves exposing the body to cold temperatures, either through cold showers, ice baths, or outdoor activities in cold environments. These practices can stimulate the body's natural thermoregulation mechanisms, leading to various physiological benefits. However, from an environmental perspective, cold exposure therapy is intriguing due to its potential to reduce energy consumption. Traditional methods of cooling, such as air conditioning, consume significant amounts of energy, contributing to greenhouse gas emissions and exacerbating climate change. In contrast, cold exposure therapy relies on natural cooling methods, which require minimal energy input. By incorporating cold exposure practices into daily routines, individuals can reduce their reliance on energy-intensive cooling systems, thereby decreasing their carbon footprint. Sustainable cooling solutions. In addition to the energy efficiency aspect, cold exposure therapy can also inspire the development of sustainable cooling solutions. As the demand for cooling continues to rise globally, finding environmentally friendly alternatives to traditional cooling methods is crucial. Cold exposure therapy offers insights into how the body can adapt and thrive in cold environments, which can inform the design of sustainable cooling technologies. For example, researchers are exploring the use of passive cooling techniques inspired by the human body's thermoregulation mechanisms. These techniques aim to create buildings and systems that can naturally cool themselves without relying on energy-intensive air conditioning. By studying the physiological responses to cold exposure therapy, scientists can develop innovative cooling solutions that are both energy efficient and environmentally friendly. Cold exposure and climate change mitigation. Beyond the direct energy savings and sustainable cooling solutions, cold exposure therapy can contribute to climate change mitigation through its impact on individual behavior. Engaging in cold exposure practices can foster a deeper connection with nature and increase awareness of environmental issues. This heightened environmental consciousness can lead individuals to adopt more sustainable lifestyles and make conscious choices that reduce their carbon footprint. Furthermore, cold exposure therapy can enhance mental resilience and discipline, qualities that are essential for addressing the challenges posed by climate change. By developing a greater tolerance for discomfort and adversity through cold exposure, individuals may be more inclined to take action and make the necessary sacrifices to combat climate change. Cold exposure and sustainable agriculture. In addition to its potential impact on energy consumption and cooling solutions, cold exposure therapy can also intersect with sustainable agriculture practices. Cold exposure can stimulate the production of certain proteins and hormones in plants, enhancing their resilience to cold temperatures and improving their overall health. This can reduce the need for synthetic pesticides and fertilizers, promoting organic and sustainable farming practices. Furthermore, cold exposure therapy can inspire individuals to grow their own food and engage in sustainable gardening practices. By cultivating their own fruits, vegetables, and herbs, individuals can reduce their reliance on industrial agriculture, which often contributes to deforestation, soil degradation, and greenhouse gas emissions. Cold exposure therapy can thus play a role in promoting sustainable food production and reducing the environmental impact of the agricultural sector. In conclusion, while primarily focused on individual health benefits, cold exposure therapy has the potential to contribute to climate change mitigation efforts. Through its energy efficiency, inspiration for sustainable cooling solutions, impact on individual behavior, and potential applications in sustainable agriculture, cold exposure therapy can play a role in promoting environmental sustainability. By incorporating cold exposure practices into our lives, we can not only improve our well-being but also contribute to a healthier planet. 11.4 Cold exposure and sustainable agriculture. Cold exposure therapy, which involves exposing the body to cold temperatures for therapeutic purposes, has gained significant attention for its numerous health benefits. However, the benefits of cold exposure extend beyond human health and can also have a positive impact on sustainable agriculture. In this section, we will explore the relationship between cold exposure and sustainable agriculture, highlighting how cold exposure techniques can contribute to more environmentally friendly and efficient farming practices. Enhancing crop production. Cold exposure can play a crucial role in enhancing crop production and improving agricultural practices. One of the key benefits of cold exposure in agriculture is its ability to stimulate plant growth and development. Cold temperatures can trigger physiological responses in plants, such as increased production of antioxidants and stress-related proteins, which can enhance their resilience to environmental challenges. By subjecting crops to controlled cold exposure, farmers can promote stronger root development, improved nutrient uptake, and enhanced resistance to pests and diseases. Cold exposure can also help regulate plant hormone levels, leading to better flowering, fruiting, and overall crop yield. These benefits can contribute to more sustainable agriculture by reducing the need for chemical fertilizers, pesticides, and other synthetic inputs. Extending growing seasons. Another way in which cold exposure can support sustainable agriculture is by extending growing seasons. In regions with short growing seasons or harsh climates, farmers often face limitations in terms of the types of crops they can cultivate and the length of time they have for cultivation. Cold exposure techniques, such as using cold frames, hoop houses, or other protective structures, can create microclimates that allow for the cultivation of crops outside their typical growing season. By extending the growing season, farmers can increase their crop diversity, improve food security, and reduce their dependence on imported produce. This can have significant environmental benefits by reducing the carbon footprint associated with long-distance transportation and the energy-intensive processes involved in food preservation. Pest and disease management. Cold exposure can also be an effective tool for pest and disease management in agriculture. Many pests and pathogens have specific temperature requirements for their survival and reproduction. By subjecting crops or stored produce to cold temperatures, farmers can disrupt the life cycles of these pests and reduce their populations. Cold exposure can be particularly useful in post-harvest storage, where it can help control the growth of fungi, bacteria, and insects that can cause spoilage and reduce the shelf life of agricultural products. By implementing cold exposure techniques, farmers can reduce the need for chemical pesticides and preservatives, leading to safer and more environmentally friendly food production. Water conservation. Water scarcity is a significant challenge in agriculture, particularly in arid and semi-arid regions. Cold exposure techniques can contribute to water conservation by reducing the water requirements of crops. Cold temperatures can slow down plant transpiration rates, reducing water loss through evaporation. By implementing cold exposure methods, such as using mulch or shade covers, farmers can create a cooler microclimate around plants, reducing their water needs and increasing water use efficiency. This can help conserve water resources, minimize irrigation requirements, and promote sustainable water management practices in agriculture. Energy efficiency. Cold exposure techniques in agriculture can also contribute to energy efficiency and reduce the carbon footprint of farming operations. For example, using cold storage facilities or refrigeration units powered by renewable energy sources can help minimize the energy consumption associated with food preservation and storage. Additionally, implementing cold exposure methods for crop preservation, such as cold drying or freezing, can reduce the energy-intensive processes involved in traditional drying or canning methods. By adopting energy-efficient cold exposure practices, farmers can contribute to a more sustainable and environmentally friendly agricultural sector. Conclusion. Cold exposure therapy not only offers numerous health benefits for individuals but also holds great potential for sustainable agriculture. By harnessing the power of cold temperatures, farmers can enhance crop production, extend growing seasons, manage pests and diseases, conserve water, and improve energy efficiency. These practices can contribute to more environmentally friendly and efficient farming methods, reducing the reliance on synthetic inputs and minimizing the carbon footprint of agricultural operations. As we continue to explore the potential of cold exposure therapy, it is essential to recognize its broader applications in promoting sustainable agriculture and ensuring a more sustainable future for our planet. 12. Conclusion and practical tips. 12.1 Incorporating cold exposure into daily routine. Incorporating cold exposure therapy into your daily routine can be a transformative experience for both your physical and mental well-being. By gradually exposing your body to cold temperatures, you can unlock a range of benefits that can enhance your overall health and resilience. In this section, we will explore practical tips on how to incorporate cold exposure into your daily routine effectively. Start slow and gradually increase exposure. When beginning cold exposure therapy, it is crucial to start slow and gradually increase your exposure to cold temperatures. This gradual progression allows your body to adapt and build tolerance over time. Begin by incorporating short bursts of cold exposure, such as taking a cold shower for a few seconds or ending your regular shower with a blast of cold water. As your body becomes more accustomed to the cold, you can gradually increase the duration and intensity of your cold exposure sessions. Choose the right cold exposure method. There are various methods of cold exposure, and it's important to choose the one that suits you best. Some popular methods include cold showers and baths, ice baths or cryotherapy, outdoor cold exposure, and breathing techniques. Experiment with different methods and find the one that you enjoy and can easily incorporate into your daily routine. Remember, consistency is key when it comes to reaping the benefits of cold exposure therapy. Incorporate cold exposure into morning routine. One effective way to incorporate cold exposure into your daily routine is by making it a part of your morning ritual. Start your day with a cold shower or end your regular shower with a few minutes of cold water. The shock of cold water in the morning can help wake up your body and mind, increase alertness, and boost your energy levels for the day ahead. Additionally, cold exposure in the morning can have a positive impact on your circadian rhythm, helping to regulate your sleep-wake cycle. Use cold exposure as a post-workout recovery tool. Another opportune time to incorporate cold exposure into your routine is after a workout. Cold exposure can aid in muscle recovery by reducing inflammation and promoting blood circulation. Consider taking an ice bath or using cryotherapy after intense exercise sessions to help alleviate muscle soreness and speed up recovery. The cold temperatures can also help cool down your body and regulate your core temperature after a vigorous workout. Make cold exposure a social activity. Cold exposure doesn't have to be a solitary practice. Consider making it a social activity by involving friends or family members. Organize cold water swimming sessions or outdoor winter activities together. Not only will this make the experience more enjoyable, but it can also provide a support system and accountability to stick with your cold exposure routine. Sharing the benefits and challenges of cold exposure with others can create a sense of camaraderie and motivation. Stay consistent and listen to your body. Consistency is key when it comes to incorporating cold exposure into your daily routine. Aim to make it a regular practice rather than an occasional occurrence. However, it's important to listen to your body and adjust accordingly. If you're feeling unwell or excessively fatigued, it's okay to skip a cold exposure session. Pay attention to any signs of overexposure or discomfort and adjust the duration and intensity of your cold exposure accordingly. Find ways to stay warm. After a cold exposure session, it's essential to find ways to warm up your body. This can be done by wearing warm clothing, drinking hot beverages, or engaging in physical activity to generate body heat. By taking steps to warm up after cold exposure, you can ensure that your body returns to a comfortable temperature and minimize the risk of feeling excessively cold or chilled. Incorporating cold exposure therapy into your daily routine can be a powerful tool for improving your physical and mental well-being. By starting slow, choosing the right method, and staying consistent, you can unlock the numerous benefits that cold exposure has to offer. Remember to listen to your body, adjust as needed, and enjoy the journey of exploring the frozen frontier of cold exposure therapy. 12.2 Choosing the right cold exposure method. When it comes to cold exposure therapy, there are various methods you can choose from to incorporate into your daily routine. Each method offers unique benefits and challenges, so it's important to consider your goals, preferences, and overall health before deciding which approach is right for you. In this section, we will explore different cold exposure methods and provide guidance on how to choose the one that suits you best. Cold showers and baths. One of the simplest and most accessible methods of cold exposure is taking cold showers or baths. This method involves exposing your body to cold water for a certain duration. Cold showers are a great starting point for beginners as they are easy to incorporate into your daily routine. They can help improve circulation, boost mood, and increase alertness. If you prefer a more intense experience, you can try ice baths. Ice baths involve immersing your body in a tub filled with cold water and ice. This method is commonly used by athletes to aid in muscle recovery and reduce inflammation. However, ice baths can be quite challenging, especially for those who are new to cold exposure therapy. It's important to start with shorter durations and gradually increase the time as your body adapts. Cryotherapy. Cryotherapy is a method of cold exposure that involves exposing your body to extremely cold temperatures for a short period. This can be done through whole-body cryotherapy chambers or localized cryotherapy, where specific areas of the body are targeted with cold air or ice packs. Cryotherapy sessions typically last a few minutes. Cryotherapy offers many benefits, including reduced inflammation, pain relief, and improved athletic performance. It can also help with skin conditions and promote overall well-being. However, it's important to note that cryotherapy is not suitable for everyone, especially those with certain medical conditions such as Raynaud's disease or cold allergies. It's crucial to consult with a healthcare professional before trying cryotherapy. Outdoor cold exposure. Another option for cold exposure therapy is spending time outdoors in cold weather. This can involve activities such as winter hiking, ice swimming, or simply spending time in a cold environment. Outdoor cold exposure allows you to experience the natural elements and can provide a sense of adventure and connection with nature. Outdoor cold exposure offers unique benefits, including increased mental resilience, improved immune function, and enhanced mood. However, it's important to take safety precautions when engaging in outdoor activities in cold weather. Dressing appropriately, staying hydrated, and being aware of your limits are essential to ensure a safe and enjoyable experience. Breathing techniques for cold exposure. Breathing techniques can be combined with other cold exposure methods to enhance the benefits and improve your ability to withstand the cold. Techniques such as Wim Hof method or Tumo breathing involve specific breathing patterns that can help regulate your body temperature and increase your tolerance to cold. These techniques can be practiced during cold showers, ice baths, or outdoor cold exposure. They can help you relax, focus, and control your body's response to the cold. However, it's important to learn these techniques from a qualified instructor and start slowly to avoid hyperventilation or other adverse effects. Choosing the right method for you. When choosing a cold exposure method, it's important to consider your goals, preferences, and overall health. If you are new to cold exposure therapy, starting with cold showers or baths can be a gentle introduction. As you become more comfortable, you can gradually explore other methods such as cryotherapy or outdoor cold exposure. It's also important to listen to your body and pay attention to any discomfort or adverse reactions. If you have any underlying health conditions or concerns, it's advisable to consult with a healthcare professional before starting cold exposure therapy. Remember, the key to successful cold exposure therapy is consistency and gradual progression. Start with shorter durations and lower temperatures, and gradually increase them as your body adapts. It's also important to practice cold exposure in a safe and controlled environment to minimize any risks. By choosing the right cold exposure method and incorporating it into your daily routine, you can reap the numerous benefits that cold exposure therapy has to offer. Whether you prefer the simplicity of cold showers, the intensity of cryotherapy, the adventure of outdoor exposure, or the combination of breathing techniques, finding the method that resonates with you will help you embark on a journey towards improved physical and mental well-being. 12.3 Gradual progression and cold exposure. When it comes to cold exposure therapy, it is crucial to approach it with caution and gradually build up your tolerance to the cold. Gradual progression is key to ensuring a safe and effective experience with cold exposure. This section will explore the importance of gradual progression and provide practical tips on how to incorporate it into your cold exposure routine. Understanding gradual progression. Cold exposure therapy involves subjecting your body to cold temperatures, which can be a significant stressor for your system. By gradually exposing yourself to colder temperatures over time, you allow your body to adapt and develop resilience to the cold. This gradual progression helps minimize the risk of adverse reactions and allows you to reap the maximum benefits of cold exposure. Why gradual progression is important. Safety. Gradual progression is essential for your safety during cold exposure therapy. Sudden and extreme exposure to cold temperatures can lead to hypothermia, frostbite, or other cold-related injuries. By starting with milder forms of cold exposure and gradually increasing the intensity, you give your body time to adjust and minimize the risk of harm. Adaptation. Cold exposure therapy aims to stimulate your body's natural adaptive responses. By gradually exposing yourself to colder temperatures, you allow your body to adapt and develop physiological changes that enhance your tolerance to the cold. This adaptation process takes time, and rushing it can hinder your progress and potentially lead to negative outcomes. Sustainability. Gradual progression ensures that you can sustain your cold exposure practice in the long term. By starting slowly and gradually increasing the intensity, you make it easier for yourself to incorporate cold exposure into your daily routine. This sustainable approach increases the likelihood of sticking to your practice and reaping the long-term benefits. Practical tips for gradual progression. Start with milder forms of cold exposure. If you are new to cold exposure therapy, begin with milder forms such as cold showers or baths. This allows your body to acclimate to the sensation of cold gradually. Start with shorter durations and lower temperatures, and gradually increase them as your tolerance improves. Increase exposure time gradually. Once you are comfortable with milder forms of cold exposure, gradually increase the duration of your sessions. For example, if you start with a 30-second cold shower, aim to add an additional 10 seconds every few days until you can comfortably tolerate longer exposure times. Progress to colder temperatures. As you build tolerance, you can gradually decrease the temperature of your cold exposure. For instance, if you start with a lukewarm shower, gradually decrease the temperature over time. Listen to your body and ensure that you are not pushing yourself too far too quickly. Monitor your body's response. Pay attention to how your body responds to cold exposure. If you experience any adverse reactions such as excessive shivering, numbness, or dizziness, it may be a sign that you are pushing yourself too hard. Take a step back and allow your body more time to adapt before progressing further. Listen to your body. Everyone's tolerance to cold is different, so it's important to listen to your body's signals. If you feel uncomfortable or experience any pain or discomfort, adjust your cold exposure accordingly. Gradual progression should be tailored to your individual needs and comfort levels. Seek guidance if needed. If you have any underlying health conditions or concerns, it is advisable to consult with a healthcare professional before starting cold exposure therapy. They can provide personalized guidance and ensure that you approach cold exposure in a safe and appropriate manner. Remember, the goal of gradual progression is to challenge yourself without overwhelming your body. By taking it slow and steady, you can safely and effectively incorporate cold exposure therapy into your routine and experience its numerous benefits. 12.4 Safety Guidelines in Cold Exposure. While cold exposure therapy can offer numerous benefits for physical and mental well-being, it is essential to prioritize safety when engaging in this practice. Cold exposure, especially when done improperly or excessively, can pose risks to individuals. Therefore, it is crucial to follow safety guidelines to ensure a safe and effective experience. This section will provide you with important safety guidelines to consider when incorporating cold exposure into your routine. Start slow and gradually increase exposure. One of the most important safety guidelines for cold exposure therapy is to start slow and gradually increase your exposure over time. Your body needs time to adapt to the cold, and pushing yourself too hard too soon can lead to adverse effects. Begin with shorter exposure times and lower temperatures, such as taking shorter cold showers or spending a few minutes in a cold bath. As your body becomes more accustomed to the cold, you can gradually increase the duration and intensity of your cold exposure sessions. Listen to your body. It is crucial to listen to your body during cold exposure therapy. Pay attention to any signs of discomfort or distress. If you experience intense shivering, numbness, dizziness, or difficulty breathing, it may be a sign that you are pushing yourself too hard or that the cold exposure is not suitable for you. Everyone's tolerance to cold is different, so it is essential to respect your body's limits and adjust your cold exposure accordingly. Avoid cold exposure if you have certain health conditions. While cold exposure can be beneficial for many individuals, it may not be suitable for everyone, especially those with certain health conditions. If you have cardiovascular problems, such as hypertension or heart disease, it is crucial to consult with your healthcare provider before engaging in cold exposure therapy. Similarly, individuals with respiratory conditions, such as asthma or chronic obstructive pulmonary disease, COPD, should also seek medical advice before starting cold exposure. Your healthcare provider can provide personalized guidance based on your specific health needs. Do not expose yourself to extreme cold. Extreme cold temperatures can be dangerous and increase the risk of frostbite and hypothermia. It is essential to avoid exposing yourself to extreme cold without proper protection. If you are engaging in outdoor cold exposure, make sure to dress appropriately in layers and cover exposed skin. Additionally, avoid staying in extremely cold environments for extended periods. Always prioritize your safety and well-being when engaging in cold exposure therapy. Stay hydrated and warm up properly. Cold exposure can cause the body to lose heat more rapidly, leading to increased fluid loss. It is crucial to stay hydrated before, during, and after cold exposure sessions. Drink plenty of fluids to maintain proper hydration levels. Additionally, warming up your body before cold exposure can help prepare your muscles and improve blood circulation. Engage in light physical activity or perform dynamic stretches to warm up your body before exposing yourself to the cold. Avoid cold exposure if you are sick or fatigued. If you are feeling unwell, fatigued, or have a weakened immune system, it is advisable to avoid cold exposure therapy until you have fully recovered. Cold exposure can put additional stress on your body, and engaging in it while already compromised may hinder your recovery process. Prioritize rest and allow your body to heal before resuming cold exposure therapy. Seek professional guidance. If you are new to cold exposure therapy or have specific health concerns, it is always beneficial to seek professional guidance. Consulting with a healthcare provider, a trained cold exposure therapist, or a certified instructor can provide you with personalized advice and ensure that you are engaging in cold exposure safely and effectively. They can help tailor a cold exposure plan that suits your individual needs and guide you through the process. Conclusion. Safety should always be a top priority when engaging in cold exposure therapy. By following these safety guidelines, you can minimize the risks associated with cold exposure and maximize the benefits. Remember to start slow, listen to your body, and seek professional guidance if needed. With proper precautions and gradual progression, cold exposure therapy can be a safe and effective practice for enhancing your physical and mental well-being.